Okay. All right. So what we're going to do, the bills were in for this morning. Were in numeric order, which is normally not what I would do. I would have them in the order by the subcommittee breakout. So we're just going to go through it and deal with it and that in, by subcommittee. We're going to do it all, but I was gonna not follow the order, but I don't know. What do you think? Is it better to follow the order or better to jump around?
I think it's better to follow the order because we have people coming in for
Okay.
various discussions.
Okay.
And I think it's this.
Right. All right.
And there's the list.
Okay. All right. So first up is a liquor bill requiring all on-premise and off-premise licensees in state liquor stores to post visible signage warnings of potential health risk associated with alcohol. We had just passed, was it 2 years ago or a year ago, the dealing with having this the Liquor Commission having 988 posted in all our locations. So my cheat sheet said that this bill we don't really want to pass it because most of the bottles already got warning that they cause cancer and alcohol, the evils of cancer. So for us to then have a sign in the stores actually kind of takes away from what we did already, which was the importance of 988 and letting people know that if they have a drinking problem or know somebody has a drinking problem, that there is a simple way to get help. So Representative Patusek, you have a receipt?
Yep.
Okay, Representative Patusek,
On this?
okay. And so this is, so you're sitting in for Burrows, so. Okay, so you're on this subcommittee, Walsh, Sullivan, Post, Spear, and Hunt. Okay,
Spear and Hunt.
right. So you okay with killing the bill? Yeah, okay.
I think
So,
I'm on there too.
in Spear, because I like to do Republican,
1, 2,
Democrat
3,
when we
4,
do
5, 6.
motions. Okay, all right, so Representative
Are you
Patusek, seconded by Representative Spear, moves inexpedient to legislate. So this is just a full committee work section, yeah, okay. So did they give you a voting sheet, on it? No, they didn't, okay.
I think so.
All right,
Unless it's up here.
Okay,
This is work session.
just a work, yeah, she just. Okay.
No.
Robin, if you hear me, we need voting sheets for the subcommittees. Usually she's listening in. No, they just have, all they have are just worksheets where we write down what, it actually says testimony, which we don't even do testimony. Okay. All right, the motion is inexpedient. Oh, wait a minute. These are exec sheets for the executive session. We got executive session
That's
sheets.
execs.
They don't say subcommittee. We have executive session sheets, but we don't have subcommittee sheets. No subcommittee voting sheets. So we'll just wing it, well, in these worksheets, and we'll just write it. Yeah, those are just, yeah, no, those are,
Want to do that?
frankly, I've never seen these before, but yes, we'll use these. Okay. All right, so the motion is inexpedient to legislate. Any discussion on the motion? Seeing none. All those in favor, please raise your hand. 1, 2, 3, 4, 5. No, you're not on this section. Okay, sorry. Okay, remember, we're doing the liquor now. 1, 2, 3, 4, 5, 6. He's on, he's Anita. He's Anita. Yes, she was. Is. Okay, so the vote is 6-0. Okay. Okay, so
telemarketing.
Okay, next up is relative to caller identification requirements for telemarketing calls. Okay, so that is the business committee. So that is Ammon, McAleer, Herbert, Spear, Pressa, Petusik, Salvi. And boy, they got a lot of people on this
Hunt
one.
and Thaxton.
Hunt and Thaxton, okay,
There's no here.
okay.
Spear. Pressa.
All right, who would like to make the ITL motion? Don't all speak at once. You'll do it, okay? Representative Ammon,
And Thaxton.
okay. Do you remember what this bill was, how crazy this one was? You- Sure.
So it's Ammon and
It's
two,
crazy, we don't like it, period.
All right.
Just to speak to my motion, it's relative to call identification requirements for telemarketing calls. We're all annoyed by telemarketer calls. The technology is kind of ancient, and there's not a way to enforce this technologically. And it's really more of a federal issue than a state issue. So I think ITL is the right motion.
Okay, any other discussion on the motion? Seeing none. The motion is inexpedient to legislate. Everyone on the business committee, please your hand. 1, 2, 3, you're on this one. Yeah. 4, 5, 6, 7. 7 zip. Okay, next up, 1231. So this is just all over the place, isn't it? Requiring healthcare providers to disclose medical services billed to the patient's insurance carrier. Okay, yeah.
Butler, you are on the insurance subcommittee, which is what we're voting on now.
Okay, so this one my cheat sheet says we're an interim study it because we want to make sure that the constituent who had a problem actually did get their things mailed, taken care of. You're on it, right? Okay, so anybody want to make the interim study motion? All right, Spear, thank you. Okay. Interim study. All right, so this committee is, me. Okay, so this one is Burrows, Butler, Miles, Sharissa, Hunt, Spear, and Thaxton.
And Porcelli.
And Percelli.
You're the subcommittee chair.
Yeah, you were the chair. Yeah,
Thaxton. Are we here?
yeah. Oh, Percelli's at the top. That's why I didn't see it. Percelli's at the top. That's why that was indented. I thought I was so smart when I did that. Okay. Okay. So it's Percelli, Burrows, Butler, Miles, Teresa, Hunt,
Spear.
Spear, and Thaxton. Okay, the motion is interim study. Any discussion on the motion? Seeing none, all those in favor, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. 8 to zip.
Are we doing times on here? No.
No. Okay. Okay, so that is 8 to zip. Okay. Next up, HB 1232, relative insurance coverage for telemedicine services. This was the, yes, it was, the person didn't show up, so it's obviously ITL. She or he withdrew the bill. No, we never see it. So who would like to make the motion? To just, we're inexpedient to legislate. We just got to kill it. Thank you.
This is
Okay.
1232, correct?
Yep. And you can just say the sponsor requested us to withdraw it. But technically, when a bill is introduced into the committee, it really is no longer the sponsor's bill. It's really, it's our bill, and we can do whatever we want with it. And so theoretically, we can, but over my years of experience here, it's 50% of the time, when a sponsor introduces a bill, the first thing they say is, well, this is not exactly what the way it's written is not the way I meant it to be. And so, obviously, if the sponsor wants us to withdraw it, then why bother struggling with it? Okay, all right, so the motion is ITL. And this is the business committee?
Insurance.
Oh, it's insurance. Oh, yeah, because it's
Yep.
telemarketing, yeah, telemedicine. Telemedicine is definitely insurance. Okay. So that's the same committee we just had before, Purcelli, Burrows, Butler, Miles, Teresa, Hunt, Spear, and Thaxton. Okay, all those in favor of annexing being to legislate, please raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9. Oh, we got 9 this time, but
Okay.
9. Oh, somebody else is counting along with me. So. Okay. 1265, relative to the prohibiting the construction of data centers in the state and establish a committee to study the environmental impact of data centers. So Representative Ammon,
Well, I missed that hearing because I had something to do, so
yeah, but still you want to kill it.
I do want to.
Like I said, Ammon, seconded, Representative Spear, moves inexpedient to legislate. And do you want to say anything or?
I mean, actually, keep it brief.
Yes, keep it brief.
The right motion is ITL on this bill. There's a lot of fear about data centers. It's the new, foundation of the next economy, and why would we want to live in the dark ages? So
Right.
let's kill this bill.
And frankly, we have the highest electric rates in the country, so why would anybody ever want to do that here in Hampshire? It'll be a cold day in hell, unless they put a little nuclear power plant next to it. Yeah, that's right. There we go. Okay. All right, so the motion is inexpedient to legislate. Is the motion clear? All those in favor this is the business committee. All those in favor? 1, 2, 3, 4, 5, 6, 7. Okay. 7 zip. All right, moving right along. Okay, 1281, establishing the standards for the training of comfort dogs. I'll make the motion on this one, and we're going to interim study it. This bill needs incredible amount of work if we were even to begin to do it. The Senate has a bill, and I've been assured that they're going to send us something. So when we get it, we'll take up and thrash through it. But the way the bill is written right now, it basically, there's only one dog facility that actually could qualify because it is so narrow. It's got all these narrowing languages in there, and frankly, it really is. It's something that each department should have their own in-house rules. So, but at any rate, we'll see what the Senate sends us. So the motion is interim study, and this is business subcommittee.
Yep.
Okay. Yeah, well, can you leave that right here in front of me? Can you just leave that right there? Okay. All right, so business, just a reminder, Ammon, McAleer, Herbert is now here. Spear, Pressa. Herbert is here. Okay. Patusek, Salvi, Hunt, and Thaxton. Yes, you can't see him when you're sitting. Okay, so it's interim study. Hunt, Spear. Okay. All right, the motion clear. All those in favor of interim study, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. Okay. 8 to zip. Okay. HB 1315, relative to the sale of tobacco products, e-cigarettes, devices, e-liquids, or alternative nicotine products.
That's yours.
Yeah, yeah, that's right, of course,
I'll
yes.
second it.
Okay. Yeah, this is my reinstating what we accidentally repealed. So just goes to show we do pass some things here. And there's no amendment for that one, right? Yeah, okay. All right, so I make the motion about to pass, second by Representative Petusek. And this is the Liquor Committee, which is Petusek, Burrows, Walsh, Sullivan, Post, Spear, and Hunt.
Insurance. Okay.
This is 1315. I think you're on this one. Yes,
Yeah.
welcome. This was to bring back what we accidentally deleted. We'll blame legislative services for this one. Okay, so the motion is ought to pass. All those in favor, raise their hand. 1, 2, 3, 4, 5, 6, 7, 8. Okay. All right, next up, 1347, relative to healthcare provider networks and referrals.
That's a skip.
That's a skip. Well, no, we want to talk about it, what's where we're at with it. But we're skipping it for taking, okay, so which one is this one, Representative Miles? 1347. This is, no, is this really a skip? Did I put this as a skip? Oh, I did. Maybe. Okay, yes, okay, this is relative to healthcare provider networks and referrals.
Yeah.
Right, yes. You're the sponsor. What was the,
No.
not 1347. Oh, tell us.
and Nagel.
Oh, yeah, okay. Why was I being so nice in interim setting it? Well, with changing the penalties and everything, yeah, which is like, those penalties were very draconian. Okay. Why did I feel nice about this bill? I know, it skipped to, primary care and so on. But which just means, skip just means we'll take it up again, in September. Okay. This is hospitals being meanies. And now, yeah, this is the one that Nick testified on the next one, but then he kept referring back to how great this bill was.
You should do an amendment.
The one thing that bothered me, Ben, was the idea that they would say, and this was a specialist, and someone's being referred to the specialist, and they say is, well, we're all booked up, but if you were willing to change your primary care physician, does that really happen? Yeah, you need to come up, I'm sorry. Oh, you're here. Oh, there you are. Okay, great.
So, thanks for the question. I can't speak to those circumstances. I don't know that they occur. However, I do know that the hospitals try to accommodate making capacity available for folks if they're able, right? This is a capacity issue, getting access to the specialist. And it may be that they are going through their roles and see that they're associated with the primary care that's associated with their organization and feel compelled to try to get them into that capacity. Whereas, that's their commitment to their community and their organization. I'm happy to take a look at that and find out more, but I think the crux of my testimony and the point that I tried to raise was this is mandating the provider take the referral without any contemplation of the circumstances. And I think our members try to accommodate that as best they can, whether it's having them join within their system or accommodating in other circumstances where they're able to speak with the referring provider, talk about the sense of urgency, the lack of access that may be in the constituents' existing service area, and try to accommodate that in some way.
Right, but it's one thing to say, look, we're booked out for 3 months.
Right.
That's one thing to say we're booked out for 3 months, but
Right.
you're still willing to take the booking. Okay, in other words, that, and this bill did not have a timeline on it, right? You didn't there was no timeline. I'm looking at the sponsor now. There was no timeline. So that basically it was like that at some point in time, you still got to, you would be willing to take him regardless of how far out you have to go because you're,
Right.
but
I
to
think
say is that you're only going to take in people who are in that hospital network and the doctors, the primaries, which are only in that network.
The hard part is the suggestion that they would be required to accept the referral. Think of a primary care doctor that has a full panel of patients. Now they're going to add another one. What does that mean for the existing patients? It means that the delay gets
Did
longer.
you say primary? I'm sorry, this is a
Sure,
special.
primary care, specialty care.
Right,
It's
but
it's
I
agnostic
assume this is a
to.
special, I mean, because we're talking about referrals now. We're not talking about a living
Well,
in
I
an
understand.
example.
I understand.
I have a doctor who, my Jaffrey Family Medicine is part of the Monadnock Hospital system. Okay. And I know there was one doctor, I won't mention his name, that he has now gone off private practice and he's now in that, you give me $100 a month and
Concierge.
concierge service. Okay. So the question is, does he still have privileges at Monadnock? Okay. And way this bill is written, said is that maybe Monadnock would say no if he was going to try to make a referral. Okay. So the question then is, which I think is bad. I think that, the fact that he's doing concierge is, that's a great thing. It's
Can do
choice.
that.
It's, we like choice. We like different, people like him as a physician and he didn't want to be there. So in that sense, I do support this bill,
I understand.
okay? Because that if it really is just simply saying that you've got to, allow them in. So I think that's why why I wrote interim study is that I need you to, we need to make sure that we don't need to have the statute written. And if there really is horror stories out there that some hospitals are just saying no for or referrals, especially if they say, oh, but if you choose to go in our network, take one of our primary, that's really a bad thing. So,
Okay.
Anybody else have an opinion? Representative Spear?
Does happen, it happened to me over the summer, where I was in the emergency room,
This is the heart.
and when
Right.
I left, they said, go upstairs and go make an appointment for the heart doctor, and they said no. The heart doctor's office said no, go someplace else. We don't have any room for you. So I had to
It
leave the
just
hospital.
simply said no.
That may have, respectively, that may have been a capacity issue. There are
Yeah, it could have been
enormous
anything.
demands for cardio specialists, cardiologist specialists, and an ability to take on more patients. They have to be able to manage their
Right.
capacity so they're not, creating even more delays for the patients that they already have associated, and
Right,
a
'cause it
patient
It
relationship
could have been a
with.
3-month, push out. They didn't get into the
They didn't
time.
offer that, and the fact was I was in the hospital that he worked in. It was the same hospital that
You're
he
already
worked
there,
in wouldn't
right,
give me
you're
the
already there.
referral.
I mean,
So
I,
where
I-
was your primary, right? Yeah, Priscilla.
I seem to remember, I'm not sure if it was this bill, but the county nursing home
They wanted to make sure
association.
that they were out of it, yeah.
had an issue because if they had a referral, they would need to take a patient. It might not have been the specific issue that they were in there for, but they would have to take them anyway. So I think that was an issue.
That was the other problem, right? Right, that she had a problem with that. Okay, thank you, Ben.
Thanks, Mr.
All
Chairman.
right, so we'll let the sponsor, now you understand, you're not testifying. All you want to do is try to answer these questions, and I guess my first question, are you all right with interim study?
Yes, that, if you recall yesterday, what I wanted to ask for was a study committee.
Study committee, that's, okay.
I had actually made an amendment that I shared with you, which clarifies, this is about health systems, so not nursing homes. Originally, it was drafted as health facilities, which might imply nursing homes, but it's not hospitals. It's medical groups are set up. That's where the specialists reside, but they're affiliated with the hospital, and so collectively they're a system. And the challenge is that there's no one who regulates the medical groups. The providers independently, their licenses are by OPLC. And so that's why this is more complicated than I originally realized. And with this regard to fines, we wanted to get people's attention because it's happening and it's wrong. And so it was like, if you're nonprofit, you lose your nonprofit status. If you're for-profit, you get fined $100,000. Now, I'm not wedded to that. I'm more like, this is an issue. We've gotten your attention. There are 16 people who weighed in online. They're all in support. Some of them are testimony from physicians talking about how this happens to them. They couldn't come because it's during the day and they're seeing patients. And so I did give you my written testimony that tries to make the points clear. I provided the amended language, but the part that's not here is realizing the best thing would be a study committee so that all of us can talk. It does happen, right? It does happen. And so the question is, though, the hospitals have a legitimate concern about, well, what if they're full? And so I think the issue is we as a state, have an imperfect, there's no health system, right? There's a patchwork quilt of makeshift things that are in existence, and we do the best we can to navigate. Hospitals have a mission to serve people in their community.
Okay,
And
okay,
insurers
you're testifying
cover
now.
it.
Okay.
Okay, sorry. I'm just trying to clarify the
So
issue.
healthcare facility was the other word that was a problem, and you wanted.
Well, so I gave you the amendment I had drafted, which
Oh, okay.
which says no entity in the healthcare system shall prohibit referrals. So like
Okay.
it clarifies that terminology issue, and it
Right.
clarifies how the penalties would work.
You
But
still have the
again,
penalty problem there. Okay,
my
all right.
the real issue is this just needs to be further studied. The fact
Yes.
that the AG's
Right.
office.
But as you can see, what we'll do in September is that we'll meet, the health insurance subcommittee will meet. And we'll
Okay.
really drill down and try to, get you language that would work.
Okay, and then would you like me to, because I
So
could
just be aware that we'll take it up again in September.
Okay, September.
But,
Yes.
Yeah, well, it'll be in the calendar. It'll be in the calendar, and you'll get notified that we'll be taking it up. And you're absolutely invited to be there and be
So
part.
by then, if I have more conversations with more, like I can have conversations in the meantime, convene stakeholders?
If you can get together with Ben and get language to work out that you can agree on, then even better.
Okay, thank you.
Okay? All right, so we want an interim study 1347. Who would like to make the motion? What's the matter with you guys? You don't like to have seen your name in the calendar? Okay. All right, seconded by Representative Patusek. Okay, this is the Health Insurance Subcommittee. Briselli, Burrows, Butler, Miles, Teresa, Hunt, Spear, Thaxton. All those in favor, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. Looks like we're halfway there. Okay. 9. 9. Half the committee is on the subcommittee. Okay, HB 1406, prohibiting health carriers from using artificial intelligence to change the clinical judgment of a provider. Okay, this is another one we heard yesterday. And
Comment?
this one, my note says ought to pass with an amendment. So who's going to draw, what do we need to?
You had Skip on this.
I know Skip is going to be for today, because we will not have an amendment ready. Okay, so, but this is a work session, so this gives us an opportunity to decide what we want to see in that amendment, if we were to pass it,
I-
and which we will then take up in next, a
Right.
week from Tuesday.
Just a comment.
Yeah.
I thought that the intent and the wording of this bill was extremely clear. And I saw no problem with it, the way it was written. There was a lot of back and forth on it, and some people didn't get it, which really disappointed me. Again, I thought it was a very good bill. Thank you.
Would you believe? Yes, okay. Yes, Representative Spear.
Yesterday, the insurance department sent us all the proposals that they're working on for this sort of stuff and everything else that they're working on
Right,
related to this, and this was in there.
right. So my memory was the insurance department is going to do an amendment for us. At least that's what my notes say to me.
We are addressing a lot of these AI issues already. We have the AI bulletin that I believe Jen
We
Smith
did, I did get
circulated
that.
to all of
I
you
don't know
as
if you all
well.
got that, but we did get that email
Yeah,
to us.
as well as our claims administration rules and our utilization rules that have specific provisions about the use of AI. We want to ensure everyone that it's already a requirement that a person has to make that final decision. It cannot be made by a machine, but we're happy to try to come up with an amendment that would address any concerns.
Okay, so is that all right? And really, the issue was that, and ironically, that bulletin was a while ago, and I had made it clear that whenever it came to a denial, if the insurance department was ever, insurance company was ever to deny it, then that has to be, if it's denied by the machine, AI machine spit it out, there has to be a human being who has to own it, has to read it and claim it and be able to defend it.
It's not just a denial, right? It's also a downshifting of what the value is, of, the code. So
Right,
it's not
and that
just
is,
a
that was the detail that, is now in that new bulletin.
Yes, it
that
is.
They're working in, and that's in the bulletin. Because that was like multiple pages. I was surprised, I've never seen a bulletin with that many pages in it.
And yeah, that bulletin was it was drafted in collaboration with the NEIC. So this is the framework that all states are using to regulate AI, and this is how the NEIC is proceeding. So we adopted in our rules a lot of that terminology around the definitions of AI, machine learning, algorithms, all of that, and it's going to be consistent among the states. I think that was one of our concerns about the bill as currently written. It refers to definitions of AI in other statutes that may not completely align with how we are already have defined it and are interpreting it. So we wanted to clean up some of that stuff.
Mr. Chairman?
Yep,
Just the other point that I wanted to emphasize is that this bill not only applied to insurance companies in denying it, but it also basically told physicians that they can use this information to access their opinion, but they can't use it as their opinion. So it was I found that very important that they could, again, take the information, but they still have to, that can't be the sole reason. So it works on both sides, I thought.
right.
Yeah, I'm not sure that as currently drafted, it goes that far, but if you wanted to include that, that's where you would have to put something probably in the OPLC statutes that regulate, the practice of medicine and the, how
OP.
different Office of Professional Licensure and Certification.
Oh, really?
They oversee all of, the professional licensures.
Yeah, no, I
So,
know. Yeah, that's-
medicine, mental health, pharmacists, all of them, you would want to have something in their statutes because that it relates to how they actually practice their profession.
Is there no reason not to have it in this statute? I read that into it, and that was agreed upon.
That was the conversation that came up, because
Yeah.
I was talking about how ironically yesterday, there was a student from Oyster River who was being accused of using AI to write papers, and she was saying, "Wait a second, this is a two-way street. Teachers are using AI to decide whether the student was using AI. In other words, they were doing AI. So, it's good, what's good for the goose is gotta be good for the gander. If you're gonna ban AI, you gotta, it's gotta go both ways. So in the same situation is that is, we certainly hope doctors are not lazy and use AI to make the claim
Right.
and send it in with an AI rather than they, hopefully, in that case, they did have to put their name to it. So
Right.
in that case, at least my issue, which is that it has to be a human, at the end of the day, a human has to own it.
I agree entirely.
I think the bill as currently written, it's in 420J, which is managed care. So it relates only to commercial insurance and how insurance companies operate. We don't have oversight over occupational licensees and anything outside of, our jurisdiction. So it would include Medicare, Medicaid, all of the federal programs, self-funded.
Okay, so my notes for today is that we are looking for an amendment that we will see on Tuesday, March 3rd.
Second,
Is that,
right?
am I
Second,
in my
third.
calendar right in my head now? Okay. All right, great. Yeah, Tuesday, March 3rd. We'll have, that's the work session, and we will hopefully be able to get an amendment done in the morning. We'll have the subcommittee working in the morning and then vote in the afternoon. Yeah, just so everybody knows for that week, we have Tuesday, Wednesday. Technically, every bill has to be out of committee Thursday, the 5th. However, Thursday, the 5th is a session day. So so then you would say, okay, we need to do everything on Wednesday. The problem is with Wednesday is that now the House Clerks is dealing with, and certainly Robin has to deal with all our reports, getting our reports done in a timely fashion. So anytime all of those who have volunteered to write the report, please start writing it sooner rather than later, so that they get done in time. So, but yes, so I'm hoping to you get everything done on that Tuesday. Tuesday morning we'll have subcommittees and go through the worksheet so we know what we're doing. Execute all in the afternoon, and that leave Wednesday open for if we have something that crash and burning that we need an extra day. Yes, Representative Herbert.
Just so I get misunderstanding. We have adopted AI as a tool that we can use at this point in time. So in other words, instead of, Mr. McAleer over there finds it good, and somebody mentions AI over here.
Yeah, your mic is not on. Sorry.
I'm getting a little confused because I
Okay.
could always put.
We're not adopting that we're saying anybody should use AI. We're not adopting that. That is not, what we're saying is
Right.
if someone were to use AI,
Oh, maybe I was not listening right,
well,
but
okay.
sounded to me as though that was.
So you received in your email last night, it was multi-pages of what the rules and regulations, if someone wanted to use AI. Okay, if they're going to use AI, what are the ground rules for the department, in terms of the insurance statute? And that's what, if you have, read it, you can.
Who
read.
makes the decision?
So in terms of who makes the decision to use AI,
Yes, sir.
okay, that's the problem. We can't regulate that. AI is anyone in this room could use AI and not tell anybody. Okay. Right. And as you might remember, Representative Ammon used it for one of his testimonies. He used AI, and I actually did get criticized. Someone told me that it was outrageous that I allowed you to do that. So, and the most important thing is that if a denial, when we're talking about insurance now, if a health insurance denial occurs, that denial can't just be, and that had been done by AI,
Right.
they can't send it out. Okay, they have to give it to a human being and have a human being sign it and own it.
So are we paying for this effort?
Who's paying for this AI?
Yeah.
No, that would be the physician's office who's filing or the insurance department is, was, if, the accusation is that insurance companies are doing that. Okay, so if the insurance company is doing it, they're doing it under their 10% of their minimum loss ratio. They're doing it to the expense of their operations, if they're actually using AI.
Thank you.
So, but actually in this bill, we had a guy who testified that every insurance company was doing that prolifically, that they're doing it.
Well, I don't doubt it. I don't doubt it.
Okay.
I was just wondering if we had anything to say with the matter.
We absolutely have something to say, yes. And we've gotten the department to do it by bulletin.
Sounded like it.
Okay. Moving on. HB 1532, relative to the maximum temperature for vape heating coils and other required safety measures. Okay, this is all federally regulated. Who would like to make this motion? Okay, perfect. Lily. All right, Representative Walsh moves ITL. You want to speak to it at all?
Yes, this is very concerning, but it's not something that a state can control since the vape devices are not manufactured here. This has to be done at the federal level so that the entire country could abide by those rules.
Now, I would mark this up as you learn something new every day. That what was dangerous is if it got low on fuel, low on what, and then if it because of the temperature heating coils, it could then produce toxic because it was burning vapors. See, now who would know that about vaping? Okay, motion is ITL. Petusek.
We should know. There's a vape issue going on that we've been discussing.
Right. Yes, we
We have a problem in this state about vaping.
okay. That's okay. The
Next
motion
one
is
we have-
inexpedient to legislate. All those on, this is the liquor committee. Liquor. So this is Petusek, Burrows, Walsh, Sullivan, Post, Spear, and Hunt. So all those in support of ITL, please raise your hand. 1, 2, 3, 4, 5, 6, 7. 7 zip. Okay?
7 zip?
Yep.
Only 7 of us.
Okay. House Bill 1538, preventing vape products from being marketed towards minors. I'm willing to make the motion.
think,
Yeah. So, yeah, my motion
What's the
is,
motion? I think we should do how to pass.
no, we can't pass this bill because the fundamental problem with this bill is that you're asking judgment. You're asking what is appropriate and what's not appropriate. What's for kids and what's not kids. We know, we have learned this experience already with the Liquor Commission when it came to when it came to, having children on the bottle, on the labels, is that asking the Liquor Commission to enforce labeling is impossible, okay? Because now it's a judgment, and we can't have that judgment because all you're doing is asking for lawsuits. So you really can't do that. And we already know that in terms of the using a highlighter as the thing, that if a student was stupid enough to do that,
No, it's
the
not about
parent-
being stupid. I think it's a no-brainer that the reason why these companies make a vape product like highlighter or video game or something that can be easily disguised in the classrooms, the reason why they make that is because they basically intend to sell to minors in different ways. Like their friends can buy it or somebody else can buy it. If their intention is to really sell to the over 21 age, which is legitimate age to buy those, then they don't have to make disguised products like that in the first place.
Why not?
Why they have to make a highlighter to sell to adult like me, for example, or you, if you want to vape? Do you really need a highlighter to vape your product? Probably not. So I understand the lawsuits, but I also feel that we already know the intention. Intention is pretty clear from those management companies. I mean, you can argue that's the thing. You can argue anything in any direction. That's the power of a human being's brain.
What agency do you think is going to be able to determine whether it's intentional for children or not?
I mean,
Who's gonna do that? And are you gonna spend money? We're gonna spend state money to hire employees whose sole
do what?
purpose is to sniff out whether they think it's marketed to kids?
that's like, you already heard testimony from high school kids. You already heard testimony from the police officers. And I don't know if anybody
Okay.
sitting here
I-
really has any doubt about that,
All right.
that
I'll
the
tell you
intention
what,
is to sell to the
interim-
kids.
We'll do an interim study motion, and if you want to vote against interim study and get it down on the House
What is the
floor
need of
and
interim
say,
study? I mean, that's the thing. We do always interim study only when we want to just push the can down the road.
I want
Or want to just, kind of make it, kill it
Well, yes,
ineffectively.
that's true. I think ITL is the right answer, but I'm willing to compromise and do.
I mean,
interim
I don't
study.
think,
Yeah, Representative
only-
Spear.
The only comment I wanted to make is I looked to find out who was making these disguised
Devices.
devices, and they're all coming in from China, and they're coming in overseas over the internet. Stores are not selling them.
Not even, right, the story, we did.
Stores
have
are
the-
not selling them,
stores-
so
they're
it's not,
they're
it's
even
not
selling these in New
anything
Hampshire.
we can evaluate, because it's not coming that way. It's going directly from the internet to somebody's house. Now, some states have forbidden that, and it hasn't worked. I looked and it doesn't really work.
Okay.
It's almost, I don't know, it's really, I think we're being targeted,
so
but that's me.
I think, we can't control the manufacturers because that's not a state manufacturer. But what we can control is the distribution of those products in the
They're
state.
not being distributed. That's the problem. They're not
They're
being,
not being
these,
sold here.
these
And we are
disguised
dealing
things are
with
not.
doing that, we're solving the nitrous oxide problem that way, okay? But nitrous oxide, it's easy. It's either got N2O in it or it doesn't.
Yeah, I mean,
Okay.
they are sold in stores. And
And we're going to ban the stores from selling
okay.
nitrous
So
oxide.
are you saying that all these
So we are
products?
going to
they-
do a ban, okay? We're going to do,
Okay, that's
we are
good.
going to get crazy and pass the ban on something.
Okay, then
Okay.
that's good.
But with this one, we're just, it's too judgmental. Representative Sullivan.
Yeah, I mean, we had the discussion after the hearing. I mean, I appreciate what he's saying, and I agree with him that, these things probably are aimed at minors at some level. But I think if we really want to get serious about this, we should probably reach out to our federal delegation. It needs to be a federal law mandating designs or something if we want it. But no state can do it because nothing's manufactured in this state. And I feel like the federal government, if they want to get serious about this, could probably, I think that's the level of government where this needs to be regulated. If we want to regulate designs, then we need to say, all right, these things are banned or whatever at the federal level. So anybody sold nationwide, if you're going to sell a vape, it has to be done that way. I think if we try to do it state by state, what New Hampshire decides will be marketed towards children will be different than Massachusetts and California and Texas. And I think it would be very ineffective. So at some level, I think while I agree with those young people who showed up to explain the situation, which is a problem. I don't think anybody in this room doesn't think it's a problem. It is. I think legislatively, I don't know how we can do it in the state of New Hampshire, particularly when so many of these things are coming from online websites, and how are we going to enforce that? I mean, and that's the question I had. I thought a lot about this. You and I talked a bunch after the session. Like, let's say, apparently we had people talk to us that they're not being sold in stores. So let's say that, a child goes online and buys something. Well, if they're not being checked by age, or they have another way around it, and then they get it and then get it in from Amazon or some other website online, then what is the tool that New Hampshire enforces that? Do we sue that online retailer? Maybe they're located in China. Like, what's the jurisdiction?
So we are assuming that everything is sold online.
I'm not necessarily assuming that, but nobody came in here with an example of something. Every example that they came in with was something that came from online. It didn't come from a store that they said the local 7-Eleven or the local vape shop had it. So, I mean, to me, it's a problem. I just don't know that this legislation will address it despite having the right intentions. And so that's sort of my take. I think an interim study is good because we can show that it's worth viewing if more information
Right.
comes to light. If these people who are
Exactly.
activists in this issue want to show up in the fall and say, you guys sort of missed the mark, here's a bunch of evidence of shops in New Hampshire selling these things, well, then maybe we should revisit. So I think interim study is an appropriate action because I think our understanding is we collectively have in this room right now is that there's probably not much of it happening in New Hampshire stores. If that's wrong, then maybe we can revisit it.
We can regulate the stores, but we can't do it online. I understand that part.
And so-
But I
so
guess
that's
I'll
my
agree with the
thinking on
interim
it.
study in that case.
Yeah, 'cause the whole point of the interim study is that we want to, if it turns out that there really was something happening here in New Hampshire in one of their stores, which
But-
hopefully it won't happen. If there was, then we have a vehicle to start working on language to address that problem.
Isn't there another issue here that I don't think we're allowed to sell vape products to minors anyway,
Well,
regardless of
Right.
anything?
No.
However it looks.
No, that's the whole idea, that there's not, you can't sell vape product to minors, but if the minors get it in some way, like their friends can get it or their whatever, then it's easy to disguise the product in the classroom. That was the whole idea.
I don't know how you're gonna legislate something like
okay,
that.
well, I actually have, and I have an answer to that question, which is a very good question. And, you know, and I have to say, yes, I did go visit a marijuana store in Massachusetts. Okay. And just, well, I have two of them right, like, you know, like within 2 miles of my house. I mean, it was hard not, it was purely research. Okay. So what I discovered is that most states have the law when it came to marijuana is you can't walk into the facility without first having your driver's license checked. And they locked it, you can't even get in. So I would say is if we find that there is a problem with vape shops in which people who are under 21 are going in there and getting,
Chairman, you know that people under 21, they're not going to go in the store themselves. They'll get it done through their friends or sometimes elder brother or friend's friend who is older. You know how it comes. That's how they're sold in campuses in high schools. Nobody in the high school is going to go to a marijuana store or those stores and buy themselves. We know that they cannot sell directly, but it's all indirect selling, and the way they can be disguised in the classrooms or elsewhere, houses, that is the main problem here. It's not the problem that minors cannot be sold. We all know that minors cannot be sold those products. We all know that.
Don't repeat yourself, but here's the point. The point is, if someone were to resell it, with someone to go in who is old enough to buy it, and then turn around and try to sell it to someone else, so we have a law against that. Okay, so therefore they are exposing themselves to be thrown in jail. So I'm
How do
pretty
you think?
sure
How do you think the people those classroom people they
there is
it's
no
credible.
doubt in my mind
They get it.
that adults give alcohol to kids. Okay? There's no doubt in my mind that that happens. Okay? But I have absolutely seen cases here in New Hampshire where the parent thought it was a great idea to let it have a party, get a kegger party after high school graduation, knowing all those kids were not old enough to drink, and says, oh, we just took the keys away from them. Okay? No, they prosecuted that parent. And so if someone wants to do that, and you're saying, well, we all know that's how they do it, I grant you.
No, we're not talking about
But
parents. We're talking about the
we're
the
only focused on trying
older
to pass
friends.
passable
Yeah.
laws, enforceable laws, laws that at least the law enforcement can live with and can deal with. That's what our charge here is, not just feel good and just put stuff on the books but are unenforceable. And
I think we can go with the interim study for the time being.
okay, all right. So, do you want to make the motion, Teresa? Do you want to make the interim study motion?
What do you want to do with this, by the way?
Interim study.
So he wants interim study also.
I want you to make the motion. You willing to? Are you going to write the blurb this time? You didn't write the committee report the last time. No, I guess I don't want
Was
you.
that?
Say I move interim study.
Okay. Okay. So I'll move to interim study. Sure.
Well, the idea of the study is that if we were to find one of these things
In the stores.
in the store, yeah, if we found one, then we have a vehicle.
It's not go find one. It's basically, yeah, we will talk. We'll talk to the people who are sponsors.
All right. I'm going to make the motion of interim study.
Okay.
Okay. Because I'm just that kind of guy.
Thank you.
Okay. All right. Is Representative Patusek moves second my motion of interim study. This is the Liquor Commission. Okay. That's Patusek, Burrows, Walsh, Sullivan, Post, Spear, and Hunt. All those in favor of the motion, raise their hand. 1, 2, 3, 4, 5, 6. Okay, so you're voting with it, or are you gonna, or are you gonna vote no?
No, I voted with it.
Okay,
voted with it.
all right, seven,
No.
7-0. 7-0. Okay. It's amazing which ones are lively discussions. Okay. House Bill 1554, requiring insurance carriers to provide a peer-to-peer review. Okay, so review in any stage of prior authorizations and mandating disclosure of reviewer credentials. Okay, so we had a long discussion on how we're going to try to do this. You are going to work on an amendment.
Yeah, I have an amendment, and I think it would, I took Ms. Paula Rogers' recommendations, and that eases up the physicians credentialing a bit, not credentialing, but options for whether they're practicing or not. And so there would be none of that worry about, increasing the net for physicians. And also, yes, SB 561 did talk about prior auth process, but it's primarily administrative. And this bill talks more about the clinical side of things. So yes, to be continued as a discussion.
Okay, but in terms of the fundamental pushback was the timing of this peer-to-peer conversation.
The discussion,
Because the way when Paula was talking, that she was referring to under our current statute, all right, and that in our current statute is that third-party review occurs when you are doing the appeal. And you wanted to have a process of where the peer-to-peer could happen even though the appeal process had already begun.
yes, the
And that
appeal
was the
process
problem. That was the
should,
problem. How, so are you gonna compromise on that any way, any which way?
well, I will
how-
discuss it, yes, but the
Okay.
premise of it is so that the patient doesn't miss an opportunity for their doctor to talk to the plan's doctor during the process.
Right,
So I have to excuse myself for a minute.
okay. All right, so we'll be, it's gonna needs amendment, all right. Okay,
Let's skip 54.
yeah, 54 will needs amendment, so we take that up on March 3rd.
Okay.
Okay, 1614, restricting the use of coal tar-based sealant products containing levels of polycyclic aromatic hydrocarbons. Okay, so this, we need to do a deep dive to really understand this issue. So this is definitely needs to be interim studied. So who would like to make that motion? Okay, thank you.
Is that Mac?
Yeah.
This is one I really want to make a motion on.
Okay, which one is that? Okay, all right, good. You have an amendment for 16. Okay, so, but, all right, we can certainly pass it around. That's what this is for. Okay.
This was based on the conversations we had that day and speaking some language. I mean, I'd like to point out too, nobody came in opposition to this. I know you don't like banning things, but nobody came in opposition to this. And I think that I did get some research on it, and there are some waterways that are struggling with these chemicals in our state. And so I think we should take it seriously, because what we heard from the testimony was all in support of it. And they said that the alternatives are no more expensive. The alternatives are much cleaner for our water. And this seems like best I can tell, this seems like a kind of a low-hanging fruit for improving the health of our waterways in the state without costing businesses money, without costing, it sounds to me from what we heard, and nobody came in to oppose this bill, that the people who are using the current coal tar-based substances, it's kind of just inertia. It's what they've always been used. It's not like a pricing problem or anything like that, or a performance problem. And this isn't unique to New Hampshire. This has, obviously been addressed in other states as well, because it is a risk. So, and these substances are accumulating in our rivers and lakes, and I think we should address that. And this seems like a relatively easy fix.
Well, no, nothing's easy.
No,
My
that's
problem
fair.
was I didn't know who was using it. Okay, and the question I posed was that when I see highway departments, state and local, and they're pouring some black something on covering, filling in cracks, and it looks like spaghetti on the road. So they're pouring a fair amount of it out there.
Mhm.
Okay, what was that? And that was not clear. And as far as I'm concerned, if that really is what we're about to ban, then we've created a huge problem for all those cities and towns because that's what they're using. So
Well,
I
but there are
wanted to interim
alternatives.
study it to really find out exactly what's being used, then I saw there was like coal tars in shampoos.
That I looked into. It's a smidgen of a percent versus the tar, and it's also a clean, a very different kind of tar.
Yeah.
You can't compare those.
They're not-
Again,
But I think
that's what I'm saying is that I don't want to jump into this banning something, ban it first and then ask questions later. That's why I
would
want to
just point
interim
out that
study this
nobody
bill.
came in concern. And
Okay, so
also
let's
there are-
I'll clear that up.
And I
The
understand where you're going. I know
person
where you're going to go.
wanted to come here. He unfortunately had something else going on at the same time.
Okay, fair
Okay,
enough.
and then he asked me, should he come to this meeting? Okay, and I assumed that we all thought pretty much that, yes, we should, and then I talked to the sponsor, and she was okay with interim study this bill.
One thing we forgot to ask that the end product of the alternative, which is asphalt-based product, is the look and finish is almost same as the coal tar
No, we
based.
didn't forget to ask that. That was addressed in the
To the
testimony.
address, what was the answer? Is it the same?
Yeah, it's the same. He said that there is really no difference. One is just cleaner for our waterways and the other isn't. There's no, according to our testimony of the people who came in, it's same performance and no difference in price. So, I mean, that's.
That was what the testimony was. Right, okay, but we don't know, we don't even know what the cities and towns are doing. We don't even know what's going on out there. Representative Mackey.
Yeah, thank you. I just have a question. Representative Sullivan, why, I think I objected to this when it was first brought up. Under line 27 exemptions, why should there be an exemption to this? And if there is an exemption, what would they be asking for? Under what reason would there be an exemption?
Well, presumably that would be if there was a real reason, a good reason, they could convince the DES or whoever's regulating it that we need this exemption. So if there is a city or town that, I don't know, has a stockpile of the stuff that we barred, maybe we say the exemption is you can use it until it's time to restock or something. I don't know. It seems like, it seems
More
to
like
me that
business
if there's really good exemptions, it's just like a step. Like if there is no reason to get the exemption, then nobody will ask for one. And if there's a really valid reason, then it's good to have that wiggle room for them to go, like, all right, all we have to do is go and make our case to the DES.
Is there
I just
anybody
don't
here
think
from
that-
DES? I saw the commissioner outside and asked him about this bill. And he said that, well, it was somebody else was in their department was supposed to be following it. And evidently they're not here either. So this is not, he said this was not a big issue for them. This was not something that they're following or concerned about.
I just think you could take that whole exemption issue out of the bill and it would be better for it. Thank you.
But I guess I feel like the exemption allows us to ban it without worrying about major implications.
Just don't like banning something until I really know what I'm banning. I mean, it's one thing to say, okay, I know what nitrous oxide is, and I know how, how it's being, how we're trying to control it here in the state. But I don't even know what cities and towns are using this stuff. I don't even, it was so, this is a classic issue. We need, this is like we did, PFAS. You know how many study committees we had on PFAS before we finally passed it? I mean, we need to really research it and really understand how it's being used and where it's being used and how, whether this is the right answer in banning it. But the only argument I heard was it's cancer causing, and I'm pretty much sure almost everything we do is
No, I mean,
cancer
there's also
causing.
other things too, like it's very bad for the wildlife in our rivers and streams and lakes. And I did go on and look at our website online, and there
Right.
are a bunch of rivers that are suffering from this chemical.
In New Hampshire.
In New Hampshire, yes.
Which river is suffering from?
Most of them seem to be down in the seacoast area. I feel like, yeah, I don't have them
Like
all.
the Merrimack.
I don't know if the Merrimack. I mean, that's probably polluted.
Well, that's
there.
what I'm saying. It's
I mean, you
like-
fall
it's-
into the Merrimack, you
Yeah,
just
yeah,
dissolve,
yeah.
I'm pretty sure.
It's
But
got anything and everything in it.
no, I
right?
mean, I think it was more like there was, yeah, that whole area, like Newmarket, Exeter, it seemed like
Okay.
a lot of them were in there.
I just feel like we need to know more about it before we ban it. Okay, that's all I'm asking. Give it another
Well,
year.
then let's take it like a real interim study and not this death with dignity ones that
I-
you sometimes do.
We've had this conversation before. You know how
Now
I
you're on the
run,
record.
and I'm on the record that I want to do a deep dive and really understand. this
Okay, no,
product.
no,
And I
your-
want to
your
know
point
where
is
it's being
fair.
used and
Your
how
point
it's
is
being
fair.
used.
I understand you not being comfortable without understanding it better.
Right.
And we should take that time in the fall to try to understand it, and then,
Right.
and then, John, maybe you can be the one who puts in the bill next
I-
year, once we actually understand it better. If it's
As
necessary.
you know, that's exactly what happens. That at the end of the day, the amendment will have
Better
my
be what
name.
happens, Sean.
So will you be around to make sure I do it?
Who knows? Unlike.
Yes, yes, sir. Yeah, you have to come up and you have to use the mic. Not like the old days when subcommittees, we were just,
Good job defending this bill. You mentioned the crack fillers
Yes.
that towns, DPWs use.
Yeah.
Those are not seal coating products. So those do not apply, would not.
what are they? They sure look like they're sealing cracks.
Well, they're just like a rubberized type of material. It's mostly a rubber type of compound, but they're not a coal tar based product. So those don't, seal coating's not used on roads or highways. They're not used on, and they don't, crack fillers don't fall under that category. Only seal coats are used on parking lots and driveways. And the exemptions that you mentioned, those exemptions were mimicked from what other states and municipalities have used in previous bills. It's basically a way out. It's all about research. So if someone wants to invent a new type of parking lot seal coat, they should be allowed to use the coal tar stuff as part of their study. So that's all that the exemptions are. Okay, thank you.
I have a quick question actually. If we have a very good alternative called asphalt-based product, and pricing wise is fine, quality wise is almost same, why would somebody even continue the old product of coal tar? What is the logistic behind that? Is it just because there's inertia to change?
Again,
Inertia.
as far as we know, nobody might be using it. That's
Inertia
the
to
whole point.
change?
We might not know, what I want to know, if it's banned, is this going to be like PFAS, that we end up banning things that nobody's using anyways? So that is exactly the question I want answered. Is right, who actually is using this product in New Hampshire? That's what I want to know.
Okay, that's a fair point.
That's what I want to know, and if nobody's using it, then yeah, we can pass it in a heartbeat.
Do you know if it's still being used? that you're
It's
aware
used everywhere. There's a whole, just Google seal coating contractors in New Hampshire, you'll see a map pop up. A lot of them come up from Massachusetts. You want to see seal coating, go to Squamboats Marina up in Holderness. They seal coated a couple years ago with coal tar, their parking lot and their boat ramp. All right, so all this stuff is washing off right into the lake. Go to Wentworth by the Sea on Mother's Day, like I did, and a beautiful hotel. The entire parking lot was seal coated with coal tar, and they don't have drains. It all goes directly into the ocean from
Then
there.
the same question comes, why do they use coal tar? When the product,
They've been using it since the 1940s.
they just don't want to change.
England was using coal tar for paving in the 19th century. All right, so coal tar was once a widely used hydrocarbon tar, coal tar.
It's
So is it
lack of
just inertia?
education then.
It's just kind of like inertia. They're comfortable with it. They just keep using it's there. They
Of course.
Right, right. It's
Yeah.
just say you got used to and
That's
just keep
fine.
using the same thing.
They've been using it for
Okay,
centuries.
hence my point why I want to interim study this, so we can go out and do a field, we can really understand exactly what's going on out there, okay? But to pass this ban without really knowing its usage, I mean, I personally thought, and anybody who does that black stuff all over their asphalt and rather than re-asphalting it are nuts. All right, because it seems to me the cracks just reappear within a year or two. So it's like, what a waste of money to do it, other than I guess
Well, they
makes
do it for a reason.
cosmetic. Yeah.
It is, it's
So,
cosmetic. It's,
all right.
try to resurface like a Walmart parking lot or a Market Basket parking lot with asphalt. It would cost a fortune, where you can just seal coat it every 3 or 4 years and give it basically a pretty paint job. That's all it is. I don't like it. I wouldn't put it on my driveway, but
I would re-asphalt.
Yeah.
You get an asphalt driveway, you got a crack, you re-asphalt it. Okay, so Representative Sullivan, would you like to make the interim study motion for me?
Yes, let's make an interim study, and John is on record. He will look at it with good faith and open minds.
Because I hate that stuff. I think it's just incredibly stupid to put all that crap all over your driveway. So I will second the motion. Let alone the shampoo.
Does that mean I have to write the report, right?
Yes, you have to write them, so that way you can say how the chairman of the committee is highly committed to getting to the
Chairman of the
bottom.
committee wants to chair a study committee. I can't
Study-
wait.
Right, we want to get to the bottom of it. Okay, so this is business. Ammon, McAleer, Herbert, Spear, Pressa, Petusik, Salvi, Hunt, and Thaxton. Okay, all those in favor of interim study, please raise your hand. All those in favor of interim study, raise your hand.
You can raise your hand.
No, he's not.
I'm not on
Yeah,
the-
you're
I'm not
on
on
it.
I'm not on this.
I thought he said his name. Oh, okay. He's on it, right. Okay, okay, right. 1, 2, 3, 4, 5, 6, 7, 8. Zip. Okay. Okay, nitrous oxide. Everybody get the amendment? So we have a technical problem with the amendment. So unfortunately, okay, so the amendment number is 0785. And this is a classic case of how to make sure that this is truly enforceable, right? Can we do it? So what this RSA 179 is, for those who are on the liquor committee, 179 near and dear to our heart, because that's the liquor statutes. So in 179, there already is a law that already exists that is called unlawful, 50, unlawful purpose. No licensee shall use or allowed to be used his or her premises for any purpose contrary to law. Very simple, if you don't do anything illegal. So we're going to add to that, is that all licensees shall comply with the provision of RSA 644-5A relative to inhaling toxic vapor. So are we going to keep that one, that part? I mean, the Merrimack, that's the actual reference to, sure. Yeah, that's fine. We just, let's get what it is and then I'll take a question.
Thank you, Mr. Chairman. Yes, all you would do is take out purpose of inhalation. Because that'll take out the
But
culpable.
Roman numeral 2 was about the huffing statute.
Everything else stays in place.
Okay. Okay, so then on line 11, so a licensee shall not sell, distribute first, or device canister containing nitrous oxide. And then what we want to delete is for the purpose of inhalation. Okay, just a second. Just want to make sure, a purpose of inhalation of exphoria, intoxication, or sensitive alteration. Yes. Okay, so in other words, again, to be enforceable, we don't want to have the law enforcement to have to know intent.
That's right.
Okay, we're taking intent away. We're just simply saying they can't sell nitrous oxide. Now, that does mean if you want to buy nitrous oxide, that you can just go online.
Or across the border.
or across the border, just like people do for marijuana. Yes, Representative Hammond.
Mr. Chair, can I tell a story?
Yes.
A short one?
Yes.
When I was a little kid, my uncle was a hot rodder. And he was
Hot
a hot rodder.
Oh, yeah, they use it for race cars.
And so a little kid in the passenger seat, he had a little switch under the dash and he flipped it and the car had like 800 horsepower instantly.
Yes.
And in the back in the trunk were nitrous oxide
Correct.
canisters.
Right.
So I worry, I mean, I had a problem with the intent. How do you enforce intent? But we may be banning, use of nitrous for that. And maybe there's only a dozen people in the state doing
This
it.
is,
No, no,
This-
this is a very
go
good
ahead.
question.
Okay.
yes.
Okay, because we specifically had this conversation. Because right now, Airgas, and the company used to be Merriam Grays, but it's now Airgas, supplies gas to all the dentists. They supply the gas
Right, well, they're
for
licensed.
the hot rod guys, the hot car guys. The
So-
N2O, they sell
So if I, let's say I get to retirement age and I want to build a hot rod,
exactly.
can I
You
buy a
just call up-
canister or do I have to go?
Yeah, you just call up Airgas and
Airgas.
and you can buy you can get, you're renting the canister because you got to return the tank to them.
Shall sell, distribute, furnish, or offer for sale any nitrous oxide device. That's what we're making it to. So how,
So
would
just
that
so
be
you
illegal?
understand who this applies to.
Okay.
This is a license, got to start with the sentence.
A licensee.
licensee. John Hunt's rule of licensure, okay? So the only people who have this license are alcohol or tobacco, vaping. So what I'm doing is I am narrowing by this language that the only people who are barred from selling this, selling nitrous oxide, are the convenience stores, the liquor store.
It's easier just to say licensees.
So-
licensees.
Or just our licensees to, it's a great question, Representative. For our purposes, all of our purposes, we're talking about our licensees. So a hot rod, automotive shop isn't a licensee. They can still sell that.
They can buy it.
Or buy
They
it,
want to buy it.
yeah.
Or they can sell it, right, if
Yeah.
they're being a supplier
So
for
who do
hot
they
dogs.
buy? Who do they,
Airgas.
they buy from Airgas?
Manufacturer,
No.
A licensed.
Now, let's say,
not through,
it's not
not
licensed.
through us.
The Airgas is not licensed. They're not regulated by us. They're not regulated by the Liquor Commission at all. That's why
They might be licensed by somebody else.
But so-
I don't know if there's any
so
license.
should someone who wants to use it recreationally go and buy it, pretending they're using it for an automotive purpose?
That is true.
And that could still happen anyway? I mean, that's,
That is true.
And that, I guess this is a stepped out approach or a layered approach, is right now we're seeing a problem in our licensed establishments. That this law would, or this bill, proposed law, would actually combat that.
can I keep going just a little bit?
Yep.
So I'll make a confession. I've been to parties where people were puffing balloons
Mm-hmm.
and I never did it. You know, it seems silly, but they just sit around giggling and laughing. I mean, what are the negative side effects?
And I'm gonna assume that
I mean,
you weren't here,
I
Representative,
was not.
for
I
the
had some
testimony.
meetings I had to.
The testimony was pretty compelling with addiction. And those people are actually still here. Those parents are still here right now. So to include a police officer from Merrimack who deals with this quite often. It is a problem. There's an addiction component to it. And all this does is try to deter from the main conduit that these people go to restrict the sales of that
So
in
You
those.
mentioned parents, and so are we talking about minors only, or are we talking about everyone?
Oh, no, the story that we were given is one of
No,
a
he was over- He was
25-year-old.
over 21.
Everybody.
So we need to
30
ban this to stop people.
We're not banning. That's the interesting, that's what's unique about this legislation. All we're saying is that those who have a license, that we give a license to sell tobacco and alcohol. Now, grant you, the reason we created that license is so we can get money from that because we tax it.
Right.
notwithstanding, we're not going to tax in 2.0, okay? But that the point of the bill is saying is that where the major source of supply that people who are doing the one-off purchase or just out of the school, then and we're just saying no. These licensees, they have the great privilege to sell the outstanding wine and beer selections that we have in the state, and they can sell all the
all we're-
tobacco and vaping equipment they want.
All we're
regardless of
restricting-
what the
I'm sorry,
way they is,
Mr. Chairman.
but we are just saying they can't sell nitrous
So
oxide.
it's kind of like a feel-good kind of thing. We're doing something, but there's many ways around it. And
If-
people figure
I-
out a way around it.
Yeah,
They-
I wouldn't say, I appreciate what
use,
you're
ease of
saying,
purchase.
Put
Representative.
little hurdles in the way.
Just like right now with marijuana.
Yeah.
Right? It's a little bit of a hurdle, the only thing, that's the only thing we got in New Hampshire is say, well, you got to go out of state. And in my case, that means I can go there without.
I think
even
there's workarounds to everything. I mean, we have some very creative people that reside in our great state here. They will find creative ways to get around the laws that we make, and we'll be back here next session to make other laws that close those loopholes. But
So
But-
just walk me through, what activity is this stopping? Like who is the gatekeeper and how, what effect is this having at all?
main gatekeeper in this addiction process is our licensees that actually sell this item. This item that has flavored mouthpieces to put on the end of these
Well,
canisters.
they've flavored nitrous oxide.
So to me, that's moral panic. That's like a moral panic. Like there's flavored vapes. Oh my God, we got to ban them. So that's kind of what I'm hearing. That's my opinion.
Yeah, that's, and you're okay to vote no. I mean, I understand, you're a libertarian.
But
you
wait a
can always
minute,
vote no.
the thing
Yeah,
that
you
we
don't-
heard most
We
from,
don't-
from
we
the
don't- I don't
folks who came here and spoke was that they were getting it from smoke shops.
Right.
And if we can stop the smoke shops, that's the little guys. We had testimony of someone who bought 200 at a shot and had 7,000 in her car. I mean, that seems to be the main conduit, and
Right.
this bill will stop it.
Someone who believes in recycling aluminum cans, I was very upset to see a whole closet full of empty aluminum cans.
1630.
It seems like someone with, commerce in mind.
So,
Yeah, so I think 12 states have already passed it. That's my note says. That 12 states already passed this law. Another thing is that just because there are workaround to get around things doesn't mean that we should legitimize it.
Yeah, you and I often disagree on things, so.
Yeah.
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 so,
I mean,
I understand you're gonna vote against it because you're saying is,
further study
it's a product, but what I'm going after is the lion's share of how this product is in the market. It's easily accessible. I would have to say, as someone who in the 70s was able to do a balloon or two.
what is it like? I've never done it. I just see people.
Well,
It's a lot of fun.
if you want to know, you can always take a can of whipped cream and try it out. But basically, it is. My original memory was that my dentist always put me on nitrous oxide before he did the needle,
Yeah.
the Novocaine needle, because I was hurt, and just to get, and it was a calming effect. He was a pediatric dentist, so he wants to get the patients all calm and settled. There was definitely mixing of oxygen with the nitrous oxide. So he's got the fancy equipment. So we had 2 tanks. He had, the nitrous and the oxygen. But that it does give feeling. You're definitely
How
feeling
did
like
you
you're
break
in
your
a
addiction?
cloud.
How did you break your addiction?
Well, that in terms of in this case, he just turns off the tank. Okay, you're turning it off, but he's also mixing oxygen. So the issue is, now you really love this story. So I took Drugs and Society at Boston University in the 70s.
That's a course.
That was a course. I got an A- in it, so I did really good. And that the take home lesson that I still carry even today, that what addictions created from drug addictions is relief from withdrawal. Okay, and that's why every time you take heroin, the next time you take it, you got to take a little bit more. You got to keep taking more to get relief from the withdrawal. Evidently, I got an A-, so I must have done that right. Okay, so anyway, that when it nitrous oxide, the problem is the nitrous oxide lasts 15 seconds. Okay, you just take one hit with the balloon, it's gone. All right, now, so what happens is you
keep doing it.
you keep doing it,
Right.
and then there's a desire to get crazy and buy.
Yeah, I mean, that looks like a lot, but I
Yeah,
don't- I
well,
don't know,
that
maybe-
was the other picture. The other
Yeah.
picture where the parents showed him in his closet with all the empties.
Yeah.
He should be recycling those cans.
We should prevent vape shops from selling anything addictive, right?
Well, that's, in the end of the day is we tax it. So if you want to start taxing NO2, we could tax it like a beverage, like we do with.
I
the
mean, I
bev-
don't know enough about the side effects of it. I honestly don't, but
Right.
I dislike banning things
No,
more than you do. so.
It's
Yeah.
B12 inhibitor. That's what it does. It inhibits the use of the body being able to do anything with B12, which then wrecks a whole lot of stuff in your body if it doesn't have any B12.
Don't do
And we
it.
have some
Don't do
notes
it.
on how that works. But that's what it is. It's a B12 inhibitor.
My alternate motion would be interim study, and that's my motion.
That's fine.
That's
That's
my
fine.
motion.
That's what he's.
That's what I'm gonna do.
Everybody's entitled to their opinion. Whether we agree with it or not is another story. Exactly. Okay. All right. So that needs a new amendment anyway. So we're not going to take any action today. Yes.
Thank you. I just wanted to say, at the public hearing, we had very compelling testimony from those whose lives, New Hampshire citizens whose lives have been significantly impacted by the impacts of nitrous oxide. And talking about nitrous oxide as laughing gas minimizes the risk to public health and human health harm. Physicians, dentists, whoever uses nitrous oxide legally, and in healthcare, they require informed
Yeah,
consent.
we're not doing testimony. So
Yeah.
this is a subcommittee. So you just got to get to the point that
Okay,
you want to
thank you.
make. Maybe address his issue.
I'm grateful to hear that this consideration been given to the amendment, leaving off that part about intent, basically because it really is unenforceable. So I thank you.
All right, so that needs amendment, so we'll move on. Okay, 1638, creating a bypass mechanism for health insurance step therapy protocols with medically necessary.
Before we move on, when are we going to get the amendment?
The amendment, we will, March 3rd.
March 3rd.
Because I'm not around next week.
Yeah.
No, that's fine. I just wanted a date.
Date certain. Okay.
I know, I just wanted to.
All right, who would like to make the interim study motion for 1638? Because that's what the sponsor wants us to do. Okay, thank you, Representative Miles. Okay. And this is health insurance? Yep. So the health insurance, Bricelli, Burrows, Butler, Miles, Teresa, Hunt, Spear, and Thaxton. Okay, all those in favor of interim, oh, but 2 seconds. No, is he on it? No, I did. I second it. Okay, all those in favor say aye. Yeah, you're on it. The interim study is the motion. Yeah, the sponsor wants us to do that because the sponsor knows what good job we do with interim study. Health. 1, 2, 3, 4, 5, 6, 7, 8. 8-0. Okay. Yeah.
Must be yesterday.
1656. This is a health insurance mandate, and for those who are new to the committee, one of the interesting things that have occurred over the years was the Affordable Care Act. And in the Affordable Care Act, otherwise known as Obamacare, there was a little feature that for those of us who have been sitting around and being on the insurance committee for years and years and years, was the dealing with mandates to health insurance. So the first thing you have to know about these mandates is that it doesn't cover 80% of the people in New Hampshire. Okay, it only covers 20%. And that the 20% are what we call, they're the individuals or the small group market, which is defined is 2 to 50. It's the small group market. So that's 420J. So Medicare, Medicaid, large employers, everybody else, they're exempt from any of our health insurance mandates. So it's a very little narrow group. And yes, so you're now asking the small employer that to have to foot the bill. Well, what was interesting was that every state had different mandates. And so therefore, as someone who's been doing this, I said, I want to be the fly on the wall when they all figure out which mandates was going to be included in the Affordable Care Act. Well, end of the day, they simply said, that's impossible, we can't do it. And so they just said, we're going to stick a stake in the ground. And so each state, whatever mandate they had already passed, they're stuck with that. Okay? They can repeal it, but that's their mandate. But if they wanted to pass a new mandate after Obamacare, Affordable Care was passed, then the state had to pay for it. So this pelvic effects, if you look at the RSA, it's 420J. So yes, this bill, to pass this bill, this amendment, this mandate is that the state would then, it would need to have a fiscal note and have a cost relative to having to fund it. So that's the reason why we don't pass health insurance mandates anymore. Thanks to Obamacare, Affordable Care Act. So at any rate, in this case, the sponsor didn't show up, right? We didn't have a sponsor.
1656.
Yeah, 1656. But even if they did, this bill would have a very uphill battle. And to be honest with you, as far as we knew, all the insurance companies were here, which is Anthem and Harvard are our two major insurance carriers for 420J, and they both cover this procedure. So it really wasn't necessary in terms of necessary. But if the sponsor thought it was, unfortunately, we never heard it. But I would say vast majority of health insurance mandates that we do see, we come across, is usually, and then we had another one, that other one we had before, that we talked about was, again, it was just 420J. So vast majority of people who are having a problem, it's usually there's someone with an employer plan. An employer plan is known as an ERISA. It was signed by Gerald Ford back in the 80s or 70, somewhere back there. And basically, it allows an employer to have their own health insurance plan and provide it, and they're exempt from 420J. They're not a participant in it. And they're actually the lion's share of employer health insurance is ERISA plans. So that's a nuance. Now that you're new on this committee, you're going to have to learn these little nuances of insurance.
I'm a victim of the ACA. I pay it every month.
Oh, you okay? You
Yeah,
good? All right.
I understand it very well.
So, okay. So I guess I'll just make the motion. ITL. Okay. This is insurance. So you all know who you are. Any discussion on the inexpedient to legislate motion? Spear.
It's you for the front.
Yeah, I'll be the first name. Okay, all those in favor of inexpedient to legislate, please raise your hand. 1, 2, 3, 4, 5, 6, 7. And those opposed? Okay. 7 to 1. Okay. And last but not least, 1830 relative changes to healthcare contracts with providers. This feels like something we did yesterday.
We're going to skip this one.
And this one, yeah, is this another? Yeah. This is another one of yours, right? Yeah, okay. So
Say anything?
so what is the status in this one? What are we?
So,
My notes said interim study, but I don't know what you wanted to do with it.
uh, actually, well, I would like to talk about it further and possibly if Mr. Bradley could come up and clarify a couple things that I think were not clear yesterday.
Okay.
That would be helpful.
Again, Ben Bradley with the New Hampshire Hospital Association. Happy to take any questions.
Yeah. Fire away.
There was some mention that maybe when these multiple changes come out, and as we discussed yesterday, they can come out, as frequently as the plan desires with 60 days notice, but still they can keep coming and coming and coming. And this bill would make it so that we have regimented, organized plan where the updates would come out quarterly and everyone would be on the same page and we would all be able to plan our time and resources. Is it true that when the updates to the manuals go to the provider, is there any way to tell, is there a table of context, or is it truly like just another big document with no red lines, no strike throughs or anything? Can you just clear that up, please?
Yeah, so it varies by carrier, so it's not consistent across the board. And it's often provided in an email link that that you would click on, and it summarizes the changes that are being made to the documentation.
So there is a summary sheet.
There is a summary
So
document.
they know where to go look to find, you made it sound like they were reading a 110-page document and not know where the changes
Well,
were.
Mr. Chairman, it's not referenced to the exact changes in the original documentation. So that's what we're asking for, is where they've made the change, give us the red line so it can be easily identified. And that's not the case now. The cadence is a major priority for us. This would be a feature that ensures we're able to comply in a more timely way versus having to compare documentation and then say, okay, here's where that change was made. The third provision, I think, we could concede on if it's that much of an obstacle to give an estimate of what your business model has demonstrated you're going to achieve in savings to hopefully lower premiums, if that's the case. But I think that's how I would respond, is it's in a link that's sent via email to a source at the hospital, a representative at the hospital that gets followed. A summary document is provided, but there's no red line. There's no reference to where the changes are being made to the
That would be
original
in the cover sheet. Right, in other words, when they send it to you,
it's a link in an email
that's
to
the document itself.
to their website where they've provided summary context of what the changes are that are being made.
Right, so you would read the summary sheet and then you'll know where to look in
For-
terms of what's been
For
changed.
every carrier at any given point during the year and trying to comply with that. Hospitals employ hundreds of people to just, not patient-facing whatsoever, to chase payment from carriers and ensure that they're in compliance with whatever standards they're trying to put forward for policy changes at any time during the year. It's excessive. It's an enormous regulatory, administrative burden. And all we're asking is to try to make it easier and more consistent to comply with these changes. We're not saying they can't be made. We're not saying they don't have the right to do it. There are provisions in this bill that outline the circumstances where you could make a change outside of the quarterly cadence to accommodate the national changes that are being made. And so another state has passed a very similar bill that enacts those quarterly changes, and this would go a long way for our members to have a better ability to comply with the cadence that is currently at any given time throughout the year.
What state was that passed it?
Maine.
Representative Hammond.
On the issue of changes, you don't get the red line document. We talk a lot about AI here and everybody's using it.
Sure.
I just did this recently. I took a document, two versions of a document. And I had to do a side-by-side comparison. And in like 30 seconds, I had exactly what I needed to know. Have you started using these tools? Because that might be a non-legislative solution.
Yeah, we've had to embrace tools that take a original documentation and overlay what is being given to us and try to decipher using whatever tools we can. I'm quite sure, I know that hospitals are trying to employ tools, but the carriers know where the changes are being made, and they're not conveying it in a clear way that ensures we're able to comply. As easy as taking what they had originally, what they've changed, and sending it to us.
I guess my question is, you as the recipient,
Mhm.
you have a document from 6 months ago or however long ago.
Sure.
And you get a new one.
Mm-hmm.
Using tools to compare them that make that a trivial task.
We're taking quite sure hospitals are trying to find any means necessary to make it as easy as possible to compare original documentation with what's being sent to them in the changes. So yes, I think they are. But why do we need to enact that cost, that administrative burden, when the carrier knows the changes and can just send us the original documentation with the changes? That's all we're asking.
And then there was that last paragraph 3, which was
Correct.
very offensive. I was saying estimate, we're just sitting here arguing about how we don't like to do, we like enforceability, and then here was this big thing about it, they're supposed to make an estimate.
I think we conceded that could be eliminated entirely.
Exactly. Okay. All
Mr.
right.
Chairman.
So we'll take this up on March 3rd.
So I'm gonna skip that one for now.
Yep.
Okay. And
Okay.
We're done for this morning.
All right. We're out of work session.
We'll see you at
Can I have your paper? I'm gonna go down and have her redo it so we can use it.
You will get it back to me,
Okay,
right?
here, I'm gonna do that.
That might
This
cheat
is
you.
all I'm gonna
Take a
do.
picture of it. That would be fine. Take a picture of it. Okay. So I want everybody to look at their sheet, look at the sheet, and be ready to jump in when we look for someone to make the motion. Don't be reluctant. You got all week to write the blurb. Raleigh, because we're not next week. So. And assuming everything ends up on the consent calendar, we're doing good.
Oh, yeah,
Except for one.
except for one.
Okay. First one, 1174, requiring all on-premise, off-premise licensees, state liquor stores to post visible signage warning and potential health risks associated with alcohol use. Representative Patusek, seconded by Representative Spear, moves inexpedient to legislate. Is there any discussion on the motion? Seeing none, the clerk will call the roll when she's ready.
It is, what number is it?
1174.
177. And the motion is ITO.
ITO. Today is the 18th.
Okay. Representative Patuchek.
Yes,
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post says yes. Representative Porcelli.
Yes.
Representative Walsh.
Yes.
Representative Thaxton is not here. Representative Miles. Yes. Representative Prisa.
Yes.
Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan. Representative Tarasa.
Yes.
Representative Salvi is not here. Representative Butler is not here. Representative Hunt.
Yes.
13 to zip.
14. Okay. Zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. 13 to zip.
13 to zip.
Okay. HB 1208, relative to caller identification requirements for telemarketing calls. And what do I have? I have Representative Ammon, seconded by Representative Spear, moves inexpedient to legislate. Is the question clear? The clerk will call the roll on inexpedient to legislate.
And that is Representative Patuchek.
yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post says yes. Representative Porcelli. Yes. Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Yes. Representative Prisa. Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Tarasa.
Yes.
Representative Salvi is not here. Representative Butler is not here. Representative Hunt.
Yes.
1, 2, 11, 12, 13, still 13.
13 to zip. All those in favor of placing 1208 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. 14.
Is there 14?
Is it 14?
There'd been one more than last week.
Oh, who walked in?
Me.
Oh, look at that. Who's
Paxton.
Did he
I
vote?
missed
No,
you.
he was not here when the question was put.
Okay.
Yeah, it was. I voted.
Well,
Oh, did
Yeah,
you
it's
vote?
Yeah.
It's 14.
Okay, then it's 14.
Paxton, Paxton. Yep, okay, 14.
Okay.
Okay.
Right. Okay. Who's good at math?
Yeah, that was 15. It would be 15.
15.
So
First
we
was
have
14,
1,
Okay,
He walked in, made it 15.
all right. That sounds much better. I thought 13 sounded like a small number to me. That did have me worried.
I miss Prisa.
Yeah.
I left you off.
There you
Okay,
go.
so 15.
Oh,
I'm sorry.
they're always leaving us short
we go.
guys off.
Okay. The next bill.
Always forgetting about us. Okay. House Bill 1231 requiring healthcare providers to disclose medical services billed to the patient's insurance carriers. And who do I have? I have Representative Spear, second by Representative Patusek. Interim study. Is the question clear? The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Priscelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Terrassa is
Yes.
here. Representative Salvi is not here. Representative Butler is not here. Representative Hunt?
Yes.
Okay, so. 14, 15, 16?
16? Who came in the room? No.
4, 5, 6,
Jesus.
7, 8, 9,
You know, you sure you've seen all these states you claim you've seen? You know?
I didn't.
It's only 15.
Okay.
6, 7,
All right. 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. We're on to HB 1232, relative insurance coverage for telemedicine services. Representative Spear, second by Representative Patusek, moves ITL, inexpedient to legislate.
And what number is that?
This is 1232.
32. ITL,
Yes.
okay.
Not this one. Look who the sponsor is. She was a no-show. Okay. The motion is inexpedient to legislate. The question clear. The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post says yes. Representative Priscelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Excuse me, Representative Spear. Representative Sullivan. Representative Terrazza.
Yes.
Representative Salvi is not here. Representative Butler is not here, and Chair?
Yes.
okay.
15 to zip.
Yay.
Okay, all those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. HB 1265, prohibiting the construction of data centers in the state and establishing a committee to study the environmental impact of data centers. Representative Ammon, second by Representative Spear, moves inexpedient to legislate. Is there any question? The question clear? Then the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon. Representative Post is here. Representative Priscelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Frog.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Terrazza.
Yes.
Representative Salvi is not here. Representative Butler is not here. 15 to zip.
And
Oh,
yes.
to the yes.
Okay, motion carries 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. House Bill 1281, establishing standards for training of comfort dogs. Representative Hunt, second by Representative Spear, moves interim study. Of the, yes.
I got an email from the sponsor that said
Yeah, get a microphone. You need a microphone.
I'm sorry. I got an email from the sponsor who says he had an amendment that should have been available to us.
So at this point, that bill has so many problems with it that we're gonna wait to see what comes over from the Senate.
Okay.
Well, that's right. He's your seatmate, right? Or was he from your town or something, or so why would he send it to you? Oh,
But he wasn't here.
when did he send it?
But he sent. Oh, okay. Oh, I got the email somehow, so.
Yeah, he sent it on Monday afternoon.
Oh, okay. But, I mean, I thought we had already agreed that we would wait to see what the Senate bill was. I mean, that was what, the enforcement, that was what everybody wanted us to do. So,
The only problem was that it said faculty.
facility.
Facility, sorry. Facility.
No, to be frank, the problem with that bill was there was only one dog provider that could comply with all the requirements in it.
She's the one who wrote the bill.
She wrote,
Oh,
they
I see
wrote
what
it,
you're saying. Gotcha.
their guidance, so, like, the dog has to be spaded. The dog had to be, a rescue dog. It had to be all this and the diet, I mean, it was unbelievable, though. Oh, yeah, you couldn't have any meat or something. I mean, it was just,
Raw
no
meat.
raw meat, right?
Raw meat.
So there was all this stuff, which, at the end of the day, personally, this is something each department, wherever doing it, whether it's police, fire, or ambulance, or whatever department, because it was the agency.
Agency,
And
yeah.
the facility was that what they were going, and they say, well, we didn't really mean facility, we mean it was like creating, another comfort dog category, and which was a whole nother problem in of itself. But that, they should have their own in-house policy. I mean, why should the state be dictating, to every Sunday? To me, that's an unfunded mandate to tell everybody how they had to operate their thing. So the bill had problems. Yep. Okay. So Representative Hunt, second by Representative Spears, moved interim study on House Bill 1281. Is the question clear? The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Charassa.
Yes.
And Representative Salvi is not here. Representative Butler is not here.
Yes.
And Representative Hunt, 15 to 0.
Okay. Vote 15 zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. On to House Bill 1315, relative to the sale of tobacco products, e-cigarettes, devices, e-liquids, or alternative nicotine products. Representative Hunt, second by Representative Petusek, moves to pass. Is there any discussion on the motion? Seeing none, the clerk will call the roll.
Representative Tuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Porcelli.
Yes.
Representative Walsh.
Yes.
Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Herbert. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Charassa.
Yes.
Representative Salvi is not here. Representative Butler is not here. And the chair is,
Yes.
Madam Clerk, I did not hear you call my name.
Oh,
and I did not. I'm sorry.
I will vote yes.
Thank you.
good, because I already wrote 15 zip down.
I'm in the wrong spot.
Okay, we'll skip over 1347 and 1406, and we're on to 1532. Relative to the maximum temperature for vape heating coils and other required safety measures, Representative Walsh, seconded by Representative Petusek, moves inexpedient to legislate. Is there any discussion on the motion? Seeing none, the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa.
Yes.
Representative Frock.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Tarassa. Representative Salvi is not here. And Representative Butler is not here. And the chair
Yes.
says yes. Thank you.
Okay. All those in favor of placing on the consent calendar, please say aye. All those opposed? All right, House Bill 1538, preventing vape products from being marketed towards minors.
Interim study, right?
We are going to interim study it. So you're going to make that motion and you're
Yes.
going to write the majority report, right? Okay.
You'd help me. I was kidding. Thank you. I will do it.
He wasn't.
That was a joke.
Okay, Representative Teresa moves.
I will write it.
Uh,
Yes.
yes, okay. Er- Interim study, okay. Is the question clear? Any discussion on the motion? Seeing none, the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
The clerk is yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Frack, excuse me. Representative Herbert. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan. Representative Tarassa.
Yes.
Salvi is not here and Butler is not here. And the chair
Yes.
is yes.
Okay. 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Okay. 1554 will skip. 1614, restricting the use of coal tar-based sealant products containing levels of polycyclic aromatic hydrocarbons. Representative Sullivan, seconded by Representative Hunt, moves interim study. Is the question clear?
1656?
1614, our favorite coal tar. Did anybody take a look at the parking lot out here? 1554, we're skipping, yes. Okay, so the motion is interim study on 1614. The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa.
Yes.
Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Butler is not here. Representative Sullivan. Representative Tarassa.
Yes.
Representative Salvi is not here. Representative
Hunt says yes. Okay. The vote is 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed? So moved unanimously. Yep.
I, DPW for the town, and he confirmed what the person said, that they don't use, my town doesn't use this
Coal
sealant
tar. Okay.
on
well,
our roads, yeah.
We'll learn more about that. Ban something that nobody uses, that'll be very reassuring. Okay, we will skip 1630 for today. 1638, creating a bypass mechanism for health insurance step therapy protocols when medically necessary. Were you gonna do this one?
I asked this one.
Yeah, Representative Miles. Okay, second by Representative Patuszek, moves interim study. Okay, Is the motion clear? All right, the clerk will call the roll.
We did 1638.
No, no,
Doing 16.
no, no, that one is,
Between the
Teresa's doing, 1538.
1538, sorry.
Okay.
Yeah.
All right.
That's what I'm writing.
The motion is interim study for 1638. The 1638, clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Priscilli. Yes. Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Yes. Representative Pratt.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Yes. Representative Butler is not here. Representative Sullivan. Yes. Representative Tarassa.
Yes.
Representative Salvi is not here. The chair.
Here. Yes.
Pardon me?
Did you vote for yourself?
I did.
Yeah, here. Yeah, here. Okay, vote is 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. 1656, relative insurance coverage for pelvic health therapy. Looks like it's my name there. Representative Hunt, second by Representative Petuzek, that for inexpedient to legislate. Is the question clear? The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Ammon.
Yes.
Representative Post is here. Representative Priscilli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Frack.
Yes.
Representative Herbert.
Yes.
Representative McAleer.
Yes.
Representative Spear. Representative Butler is not here. Representative Sullivan. Representative Sullivan. Representative Tarassa.
Yes.
Representative Salvi is not here. Representative Hunt.
Yes. Okay, vote 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Last but not least, HB 1813, relative to changes to healthcare contracts with providers. No, I thought we were going to skip this one.
Skip that one.
Yeah, okay, we're skipping that, sorry.
We're bringing on March 3rd, right?
Okay. We're all done. We're out of exec session.
Okay. Can I take a picture of yours? Is that the
Sure.
one you just did?
Yes.
Okay.
Oh, boy, we're ahead of schedule.
We've done a lot of work on those beforehand, right?
Yeah.
Like if I was in the audience, I think a lot easier.
They're just really a marvel. Right? Well, I was standing today. They don't have any.
Let me see your
Every single bill.
sheets.
they have the problem.
My sheets?
Yeah, I want to see your
Pick up
tally
and
sheets.
someone I've never seen
I just want to
before.
check them all out, that's all. I want to make sure it compares to mine. I think I screwed up one.
And, yeah, and I'll take a picture too, so I have them in case. So what do we have next?
How do you think the work session is going to go? Got a lot of bills on the-
Um,
Are we actually gonna try and? How do I feel about it?
unless I burn it, if I burn out, yeah, or do we just had something else had enough. But we'll see how complicated, see how it looks. But, I mean, we are done with all the early bills. So, I mean, theoretically, anything that we get done today and we're ready, then will just make our lives a little easier on March 3rd. Was that?
And so if I understand
I
the
think,
bill
I,
correctly,
I would,
says
you
that
know,
if I have
assuming,
commercial property-
assuming everybody has their own notes and what they want to do with all of them.
Well, no, if I have a commercial property, I can add an ADU residential.
I'm sure there's someone in here that you care about. I'm sure there's- You look to the list and there's nothing you're ready to fall off.
So are we doing this at this
Well,
point?
actually, let me put it this way,
Well, a lot
we
of
do
these- a
need
lot
to
of these
decide
things
whether
do
we want to kill it or
Residents
enter
not
and
that
study.
much of a problem because, like, even in the village district.
Oh, yeah, this is all
we
voice vote.
allow
This is all
home
voice. This is
businesses.
no, there are no roll call. votes. Okay.
The question of
Yes.
home businesses is,
Okay?
so,
Yeah, okay, yes.
I checked it with the Merrimack officer and,
go to the zone.
no, they said, yes, that's
Well,
what you
they're,
do.
you're
No,
allowed to
there's,
put a commercial.
Exclusively.
Stick a commercial
We wanna
on your
delete that.
house. Oh, okay.
Yeah, or you're gonna take the first floor and
Overnight
turn it into
containers or
whatever.
receptacle containing nitrogen.
You know,
Okay.
here's my,
Was there another
my
one?
gut
You gonna give that to me later?
reaction. That the property would have to have some commercial draw.
See the very last
I mean, there's,
Well, that would be, that's up to her.
Oh, okay, that's, okay.
Yeah,
That means
um,
traffic, it means, I think this was the
Well,
only
but
one that I
the-
had anything
I-
to do with.
I
So I live on a-
We're-
it's not a.
There might
dead
be
end
We're our
street.
usual draconian
It's
Kill
all
Bill.
residential,
And this is another work session, right?
old houses.
This is
1880s,
now a work
80s,
session.
1890s.
So this is not, is this a work session?
This is a
That's
work
always
session.
baffled. One of
This
the
one?
So
houses
this,
doesn't match any of
no,
the
that's an
others.
exec session.
Was a vapor.
So the forms
Why
she
the hell would you
gave,
put a vapor
here
in
is
the
a.
middle of a residential neighborhood?
Fill it out.
Well, I know that.
But those were reports that you would write blurbs on. It's, even if it says testimony.
What they're doing is they're turning it over to Mark
So
Twain.
just, if you just want to write the, whatever you vote.
Right,
just
what our
write it in
discussion,
there and do
exactly.
that.
That's
It's
what I
not-
said, that's
yeah,
fine.
That's
Spin you can
fine.
put on.
She just wasn't sure, and I checked with.
So
Jen
if that's
to be sure
true,
For the other ones.
you
he
know,
said
there
it
hasn't
probably
been a
doesn't
bakery
matter,
on my
but probably
street
just subcommittee
in
work session form, even though it's a
probably
notice of the
90
full
years.
committee work session, but she didn't know for sure.
Right.
so she
All
just
right.
did it.
Well,
I'm even more confused.
I would say the,
Thank you.
yeah.
Right, right?
Theoretically, she should, it should have been circling who was voting. That would be the drawback.
Well, I can do that.
Right, you can go back through it and circle
Yep,
who was,
yep.
which subcommittee was,
Right.
who
Because
was on the hearing.
we thought we weren't gonna do this on this sheet.
Right, but
when we
I'm
did
just
it.
saying that whoever,
Yep,
when you have a
yep,
vote of
yep,
6-0,
yep, yep.
which members were the ones?
This gentleman was here in the morning, but the other one wasn't.
Body on a sword.
He was here
Yeah, he
in the
was here.
morning,
Yeah.
but the other gentleman that was on the
Butler-
end over
Butler
here,
showed up a little
well,
late.
she wasn't, is that Butler?
Yeah, it's Butler.
Oh,
Don't ask me,
okay.
don't ask me what I would call.
Okay, sorry,
That
I'm
is
sorry.
Butler. That is
I
Representative
apologize.
Butler.
Yeah,
Oh, and that's my story and I'm sticking
Okay.
to it.
In my business in real estate land,
so I,
we occasionally get laws that come out of Congress that look like one person
Gee, okay,
was
because,
dishonest.
But if you're
Nita
not sure
thought,
how-
Nita thought it was supposed to be
Jammed
today.
some
Oh,
serum
maybe
off.
they.
So
If I find out, I'll let you know.
Stick to your story.
Sorry.
Lenny.
Well, no, 'cause I had this
Hence,
conversation with my
hence why Okay. Okay, all right. Start out, 10, House Bill 1215 requiring disclosure of Japanese knotweed in real property transactions. I think we should just interim study this. I am barely getting my arms around this Japanese knotweed. 1015, yeah. Yeah, I mean, but the problem, they say, well, you could just say, I don't know. And then everybody just checks off, I don't know, and then you haven't done anything. All you've done is made the purchase sale agreement, that form just makes a mess of it.
I think we should ITL it because
Okay.
spores or whatever they are can exist for dormant forever.
Yeah.
And then pop up like the week before closing. I just think it's very hard.
Yeah.
Okay.
ITL.
All right. Is everybody okay with ITL?
I'm gonna vote no, but I'm not gonna argue the point.
Because
Well.
you're a realtor?
Yeah, because I know more about.
Where's the real estate association? You gotta know.
Because I know more about Japanese knotweed than anybody in this room wants to know.
Yeah, right. Oh, good. Because you've got a lot of it. I bet you Troy would just be a haven for it.
The sides of the road have it, it's
It's
a
like-
nightmare.
Well, that,
You're doing what, ITL?
no, he doesn't,
I'm
he,
gonna vote against the ITL.
but you wouldn't want it, in the real estate agreement that the people are supposed to check off whether they know they have it or not?
Look, would be as worthless a disclosure as the lead paint disclosure, but people throw themselves they'll throw themselves on a sword for the lead paint disclosure. 99% of which inaccurately say, I don't know. The Japanese I'm not really looking to argue the case. I would be happy with an interim study and then we could talk about it, but if you've got 15 votes in the room to ITL it, I'm good with that.
Okay,
I'm good with that. I'm not.
Okay. all right, just take a walk. No.
Do we ever ban any other, or have to disclose any other,
The most
Oh, yeah.
similar thing to this would be lead paint.
The lead paint one.
And
And it-
the lead paint disclosure is worthless.
oh, okay, but we don't typically list plants or something like that, like poison ivy or something.
Well, this is
This-
different than
'cause-
poison ivy. You can get rid of poison ivy. If you have,
This is really insidious.
yeah, if you have one leaf of this that's buried less than 4 feet down in the ground, you can have a plant there.
But how would you know that? And it's
You
not.
wouldn't. I'm not
Right.
saying it's a problem,
And
but
it's,
there's,
this is one of many species. This is probably the most egregious, but there are several species, is what we heard.
there's
that-
absolutely true.
Right.
And there are many problems associated with Japanese knotweed, for one.
Mhm.
And again, like you say, there's other things too, but in New Hampshire, it is a particular problem.
Without question, but if you have several acres of land, you might know on your furthermost corner that there's a spore sitting there waiting to.
Well, you may, and so you would answer your disclosure legitimately and say, I don't know. If you don't know, you don't know, but if you don't know, then you should tell somebody.
Okay, but that's
So-
probably true of a lot
Yeah,
of things
where's
in
my-
your property that don't
Well,
require disclosure.
New Hampshire law only requires the seller
This is-
disclose the
yeah,
existence of
they're
four
right,
things.
put them right here.
That's the old,
Insulation,
Yeah.
there was two, there it
Okay.
is.
I can't remember.
I got 'em.
Oh,
Okay.
Water supply.
If I lose them, we're
disclosure,
screwed.
and whether you produce methamphetamines in your house. So, but you have a 8-page disclosure. So that's,
Don't take them away. I need here.
like
We're
I
not
said, I'm
voting
not
on
trying
it.
to.
Yeah,
That's
this is
awesome.
subcommittee.
I think it's an
Ah,
issue
don't mind me,
be
John.
worth considering at some point, but not necessarily today.
Okay. So, talking about lead paint, so I just bought this 1784 house, and the original floors are in the house. Now, they've got multiple layers of paint on them. Finest
paint you can't buy.
Right.
The reason they're still covered is because they get lead paint.
That lead really all sticks. So what I assume that if, since I'm only renting it, they don't ask you, you have lead paint in what you're renting, but, so I guess I can't, I'm stuck selling this property, never selling it, right?
But
Yeah, never was a long time. Okay. All right, so this is the business subcommittee. So just to remind everybody, Ammon, McAleer, Herbert, Spear, Pressa, Petusek, Salvi, Hunt, and Thaxton. Okay, the motion is inexpedient to legislate. How many people were in support of that? One, oh, Salvi's here. 1, 2, 3, 4, 5, 6, 7, 8, 9. This is business. 8, and those who are opposed to IDL. Okay, so 8-1. Okay, moving right along. Establishing. Yeah, who's going to want to carry that forward when we take it up next 2 weeks? Who's going to want to make the motion? Bertelli.
Oh, I'm sorry. No, I want to do the next one.
Well, you can do this one too. Perfect.
Even though I'm not on the committee, is that permissible?
Yeah. Okay. All right. 1023, establishing accessory commercial units by right. What do you want to do with this one? ITL. Okay.
Harry's second.
All right. Okay, how's everybody feel about inexpedient to legislate on this? How do I feel about it? I this is a case where I look at the sponsor and I go, do I, yeah, but it didn't make sense to me. I mean, one thing. I hate zoning. Zoning is just. I used to think it was only liquor laws that were upside down laws until my neighbors freaked out when we decided to rent the castle, and then I realized that how zoning is just as bad as our liquor laws in terms of everything is illegal until we say it's legal, and so to have this legislation and then you have this shopping list of which businesses are okay and which ones are not. That's somewhat problematic for me. Because there's always something missing. There's always something that should have been considered. And
I think one of the things that was also problematic is some of the businesses on there requires sewer connections and water connections and things like that. That isn't just, let's go build one. You just can't throw it in there. There's other things that are involved, and I think that makes it very problematic.
I think even the New Hampshire Municipal Association is also against this.
Well, but while
Yeah,
well
yeah.
intentioned, I just think it's a concept. We're allowed to have some businesses like accountants, et cetera. But once you get into infrastructure, parking, traffic, I think that it becomes a little problematic in certain areas. Some areas could accommodate them, some cannot, and I think that is what the by right is problematic.
the parking,
I feel like it's very difficult to implement the law. It's very difficult.
how do you feel, Representative Sullivan?
I'm pretty much in line with what you said, actually, but I think that the shopping list was actually the biggest concern on this. I mean, there's something that's not on here that somebody surely would want. I feel like it would just open up the door to every single term. Well, we need to add this to the list. Now we need to add this to the list. Now we need to add this to the list. I also think what I had said at the time, that if you're going to do something like this, it should be, just a cap on the square footage or something, so you don't end up having.
Wasn't there? I thought there was a cap.
Yes, but it was 1,000 or 25% of the gross space. So if you have a huge house, it could be presumably a really large space.
Right.
I feel like it should have just been like a smaller number if we were going to go that direction. But the shopping list is a problem. I think that if you want to go do this, I think a little bit more thought should be put into it. And I appreciate what Susan says with respect to it takes away control from people who maybe are concerned about their neighborhoods. And so it should be a little bit more thoughtful, because there are some businesses maybe aren't appropriate for in a place, and some that probably are.
Yeah.
The thing, I don't think this necessarily precludes in a commercial area for somebody to go to the zoning board and get a permission to do something. So this doesn't
No, well,
preclude.
in my town of Rennes, the zoning is
So I don't think we-
residential, agricultural, and light industry.
I don't think we need it, for sure.
So
ITL.
it's pretty wide open in terms of what you do, but we did have a lawsuit, and I think I talked about it before, and I thought it was pretty outrageous, which was on the corner of 202 and 119, one state highway and a federal highway, and they wanted to put in a tire warehouse, and the zoning regulation said auto repair, but it didn't say tire retail, and they lost the court case, because the zoning didn't allow it. And that seemed, I mean, and what I'll never forget, everybody hated it because all they kept saying is zoom, 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 which is the sound you're going to hear next to a tire warehouse. Okay, ITL. All right, this is again the business subcommittee. All those in favor with ICL, raise your hand. So 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. You can't vote on this one because you're on alcohol and insurance. You're not on business, but your sentiment is appreciated. Okay. Okay. All right, moving on. I had 8 to zip, or so I guess it'll be 9. Let's call it 9, right? 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, it's 9 zip. I decided to do everything by pencil now. Yeah, so 1023, it's 9 to zip. Okay, and Priscilla was that. Okay, next up, relative to printing, motor vehicle manufacturers to operate dealerships in market areas also served by franchise dealers. Well, this is the one that what we call the Tesla rule, and we passed the Tesla rule. So any manufacturer, if they want to come into New Hampshire and not have dealers, that's up to them. It's already law. So I would say ITL. I was there, believe you me, I was in the room when we voted this amendment. It had to be, it had to be.
That doesn't exist,
New car
right?
company, right.
Okay. Just wanna be
Right, so
clear.
if
You just
you're-
said any, and that, I
Well,
knew that
it
wasn't
said,
true.
any new car, new manufacturer. Because all the other manufacturers have sold their soul to the franchise model.
Yeah, I also want to remind that I think that the dealer association and the manufacturer association, they were opposing this bill during the hearing.
Yes.
So I'm just
not-
trying.
not
I,
really a
I
shock
just wrote the
that
notes. I
they're-
just thought, refresh the memory of people.
Yes, Keith.
I'm still not convinced that the state has to enforce this, that it can't be enforced in contract law. And maybe there's
I
a
agree
phase out
completely.
period that we can consider in the future. I don't think this bill's it, but maybe we can phase it out so everybody has time to adjust their contracts. And we can stop dealing with it.
Well, that's what I felt about the legislation in the first place, but boy, was I in the minority. I mean, it was overwhelming. Everybody wanted to bend over to the auto
out of the
dealers.
house if you wanted to.
Right. Right, well,
It like
I pick my fights. Right.
other manufacturing are doing the same thing in New Hampshire, like
Tesla.
besides.
Tesla's the only one who's doing it.
Okay.
And they weren't in the state at the time, so it is, maybe because we passed it, Tesla did decide to come into New Hampshire. They have a superstore in Londonderry, right? Is that Nashua? Yeah, somewhere in there.
Too, I think.
I thought it was Londonderry, but Legendary. Yeah, same place. Yeah, near the
And
airport.
then there's a Portsmouth one as well.
And it's huge, right? It's both, it's like got 25 garage bays and, you know, it could be a prison. Okay, so who would like to make the motion on that one? Okay, Representative Salvi, great. All right, so inexpedient to legislate. All those, the business subcommittee, all those are in agreement to that motion of ITL? 1, 2, 3, 4, 5, 6. And those opposed? So who am I missing? It was 9 people, right? Okay, Rev Salvi. Okay, I'm just gonna call it 9 as zip.
Did you have 9 or 8?
It's a big subcommittee. Yeah. All right. All right. Establishing a commission to study the impacts of reinsurance on the cost and availability of property insurance in New Hampshire. Right, but did we already took it? Yeah, interim study, right. And you're gonna write the blurb.
Okay, I make the motion, make it IS.
Yeah, that's it. I don't know why.
We can vote again, because we voted.
No, I'm just writing it in. Okay. Because this will be my cheat sheet going forward next week. All right, clarifying when the Secretary of State shall complete the registry of New Hampshire Decentralized Autonomous Organizations. This is your bill, Keith, right?
It's a one-liner. It just extends the deadline to
Yeah, the
January
deadline,
1st.
yeah.
Secretary of
Okay.
State's in support. I'll write the blurb.
OTP.
OTP.
Okay. Everybody all okay with that? 9-0? I'm gonna speed up the process here. Ought to pass. Who says we don't pass things?
Voted against him, it was a wipe.
You're not gonna go there. Yeah. Okay. Okay, 1124, the right to compute. We're- The other one's 9-zip, 9-zip. Not to pass. Okay, now what is this right to compute? What was this one?
This is the one with the AI testimony.
Oh, you're right, okay.
I can speak to it if you want.
No, oh, sure.
My notes say seem
Right,
reasonable.
right.
That's what my notes are.
Some people need artificial
Real
intelligence to remember.
Well, so we just ITL'd a bill that this bill is trying to put up a little bit of a barrier to. So the government would have to prove, I can't think of the word. An interest, a compelling interest to ban something, right? So I think there's a bill in the Senate. There's a lot of banning of data centers and, computation centers. And this would put up a little bit of a barrier that they'd have to get through. It would give us a little ammunition to only let the reasonable bills through. So that's the short version.
Ought to
OTP.
pass.
Yeah.
But we already have the data centers in New Hampshire, right? So what this bill is going to do anything different?
I had some questions, Joe.
Yeah, shoot.
One is that, how will this bill bring more opportunity?
Yeah. So it's going to send to the industry that we are not opposed to the data center industry. And I think as Chairman Hunt mentioned this morning or this afternoon, I can't remember, that our energy costs are high. So we need consumers to incentivize new generation. So it's sort of part of like moving our energy balance forward. So it shows that we're favorable to the industry as long as they comply with environmental regulations, noise ordinances, but we're not going to target them as an industry. That's, I don't know if you remember the testimony during the hearing, but
But we already have the data centers
we
in
have
New
a few,
Hampshire,
yeah.
right?
We have a few.
We have at least 10 to 15 data centers, not the big one.
Right, right.
So how this is going to be different then? I'm confused.
Okay, I'll give you the philosophical argument if you can follow me. it goes to extending the First Amendment, basically. That the First Amendment, I think I went over that in my testimony. The First Amendment, the freedom of the press. To our modern ears, we hear journalists, but it was actually about a machine, the printing press, the movable type of the printing press, right? So this extends the ability. You don't have to register your computer, and you don't have to get approval for the content unless you're violating the laws, right? Freedom of speech, you have the freedom to print and disseminate what you want, but you can't slander, you can't disseminate, schism or whatever they call it now, like child, things that would harm a child. There's some limits to it, and this would put that into statute, extending those rights to computation. And the analogy is computers are just logic gates. They're just and or not. Those are the three primary logic gates. All the amazing things that we're doing with it are just from different combinations of those logic gates, just like the movable type on the printing press. And so this sort of puts it in statute. It creates a regulatory, sort of like a barrier that, for instance, the bill that we ITL'd this morning would have to get through in order to, it would have to show a compelling government interest in order to regulate it. Does that make sense? Yeah.
Thank
okay.
you. YouTube.
All right.
So the secretary is the one who confirms, right?
No, that's the Dow bill. That's a different bill. That's the previous one. Yep.
So you were just talking about the right to compute.
That's it. Yep.
The right to compute, yeah. I think this is the right to compute movement is there. But I just want to also know if you can highlight, like, what is the need for this bill? As currently, we already have computational freedom, barring regulations for misuse, privacy, or child porn.
So
We already have these
The example
freedom.
is the bill that we just ITL'd at 1 o'clock, or on our
Yeah.
1 o'clock session, right?
Yeah,
We're going to see a lot more of these bills. And what this does is it puts up a barrier that those new bills, there's one in the Senate right now that was late drafted, very similar.
okay.
It's going to come here if they pass it in the Senate. If we had this statute in place, it gives us a little more ammunition to be more thoughtful about it before we just blanket.
Okay.
And not people in this room, you got to think about who's going to sit in these chairs next term and the term after that and the term after that, right? So that's the idea.
I'll be here.
You'll probably be here.
Except chairman. Okay. I
Yeah,
get
so
it.
if someone were to put in a bill that was contradictory, they would have to say notwithstanding this chapter.
Okay.
And so this chapter basically, because normally this looks like a resolution, and I don't vote for resolutions, but in this case, it's basically taking a position of that what the guardrails are around this right to compute, and what is appropriate and what's not appropriate. I.e., it's got the children abuse and that kind of stuff. So it gives a guardrail so that if somebody brings in a bill, we can say, that you've got to add notwithstanding that regulation, because we
Okay. Yeah. I know.
notwithstanding.
Okay.
You get to know words like that when you've been around as long as I have.
English. Yeah, it's been a long time.
That's how I get accused of being a lawyer. Okay. All right. So Representative Ammon moves ought to pass on 1124. All those on the business subcommittee. Okay. 1, 2, 3, 4, 5, 6, 7. Okay. Yeah.
I was busy writing.
Okay. And Spear, did you vote? Okay. And Saxon, I missed you. I didn't see you. Did you vote? Right? Yeah. Okay. So 9-0. 9-0. Okay. I guess that's why they don't do hand votes anymore. Okay. All right. Relative to subscription fees for motor vehicle features. I at this point think we should just kill it.
No, we're not. I'll fight you on this. Have you looked at the research she sent you?
Yes. The only one that seemed offensive was built on things that were already in a car.
Right.
And that that the car is going to predetermine that you had to increase it. And that was that, ironically, it was an electric car. And that Mercedes is concerned that when people put the pedal to the metal, that they will burn out their batteries faster. So
I think
the
that there's a
car
lot of
has
stuff
a
that's concerning.
governor on it that controls how the high speed. And so therefore, if you say, boy, this is really obnoxious, then you pull out your phone and you then say, yes, I'm going to pay, I don't know, it was $12, $14 a month to have so I can put the pedal to the metal on my electric car. And that was basically you're prepaying for the warranty.
So you didn't look at the research she sent you, I'm taking.
I did. No,
Well,
what I was
because
looking at was
Mercedes
sent to
isn't
me
in
by
this.
Mark Brown from the manufacturers.
Okay, this
That
is, so first of
happened
all, you
once
should have looked at what she sent
in-
you, 'cause she
in-
did.
That happened once in South Korea, and that was a mistake, and they took it.
So I think you should have looked at the research she sent you because she did a lot of research per your request and sent it off. And there's a lot of ridiculous things in here. You're
Such
paying-
as,
Okay, unlocking horsepower on cars, unlocking
That-
the
just a second.
functionality of speaker systems.
and which car was that? Because Mark Brown
Okay.
did not find a single manufacturer. that-
Volkswagen unlock horsepower for engine performance.
That's the electric car problem, yes. And I guess that's a German car problem.
And then
Issue.
you said Mercedes, not
I
Volkswagen.
misspoke.
There-
They're German, they're Volkswagen,
there's-
Mercedes, all the same.
I mean, Audi and BMW.
And then she
there's-
kept saying that New York passed it, but she didn't say, oh, by the way, the governor vetoed it. By the
there's-
way, it's not law in New York.
Okay. Anyways, so,
Why should I believe anything she said?
well, I don't know. I wish he was here to talk to you about that. I'm trying to tell you, I think this is a problem, and here's what
You want to
frustrates
interim
me.
study it?
Is ownership.
You want to study
No, I
some
want
more?
to pass it, and I'm going to fight for this, because here's the thing. People do not like the nickel and diming of our society, and that's what this is. So if I have 8 speakers installed in my car, and
Don't
you-
buy the car. Don't buy that car.
But you can't. It's not the option
Don't
to
buy that car.
I understand your free market argument, but you're paying for the equipment, and eventually you have to buy a car.
You're paying for all that rigmarole that car company wants to create.
You're paying for a car that has eight speakers in the subwoofer, and that they shut off half of them because so here's the thing: when they put all these sensors in, they put all these speakers in, you're paying for that equipment.
Okay.
You're paying for that equipment.
How is this any different than from day one? And I accidentally hit the button on my 2006 Saab. It had OnStar. It was down there, and I was trying to hit the volume, and I hit the button, and the OnStar light went on, and on the thing was OnStar. Okay, I've never activated it. I never used it for. I never do it, and it has OnStar, and it has Sirius Radio. Okay. So how's this any different than what cars had back in 2006?
Because Sirius Satellite is a different company they're contracting with to operate that service. OnStar is something where they're staffing people to help you if you have a car accident.
Okay. And
When you
speakers, I have no doubt in my mind
you
that
have
there's some kind of Sony or Dolby or somebody, or Harman Kardon.
They're
There's
installed.
some
If I don't need 8 speakers, then don't install 8 speakers. If you install 8 speakers, I should own all of those and the functionality
Well,
of
then
them.
you can pay for the extras.
You can't. You don't ever get
You
to
know
own
that
anything.
day one. You know that
No,
the
you
moment you
don't.
buy
So
the
that's
car.
the other thing. I have not met a single person, and so I put out social media about this. I've got comments and direct messages, a ton of them, because I put them out on my social media, knowing that this day when I was going to have to battle you was going to come. And so nobody, not a single person has told me, "Oh, I knew this in advance," and it annoyed me. They said, "I didn't know until 6 months in. Suddenly it shuts off." And it doesn't matter, because at the end of the day, what the car companies are doing is they're running a more streamlined production line, because they want to run one line with 8 speakers in it, and then they want to charge you for the premium, something you would have to pay for. You used to have to pay for those 8 speakers, or you get the base model that has 4 or whatever. Now they just say, "Oh, we'll just make everything with 8." Well, that's a cost that you are paying for. That cost is included in the
Again,
installation. And
Get
the
there.
same thing with the sensors. Somebody told me that they shut off like a bunch of they have all the sensors installed for lane crews and stuff. And now they're starting to shut off some of those features. That costs over $1,000 to install the sensors on those. So if every car has this equipment standard and they just shut it off with software, I'm sorry if you don't get this, but everybody is going to be
I
pissed
get
off
it
about
perfectly
this.
that you want these car companies to stop selling their car in New Hampshire. You want these cars not to come to
I
New
would
Hampshire.
love to see them try to do that.
Well, that's
not
what they'll
going to-
do. No,
No, it's
you know,
not going
even
to
better.
happen.
They're just
Go-
going
you
to
can
sell them in
brand me as that if you
Massachusetts.
want. You can
They'll
brand
buy
that.
the car in Massachusetts and then bring it up in New Hampshire.
That won't happen. It's not going to happen. It's not going to happen.
Well,
I'm telling you.
this bill's not going to go forward. This bill's not going anywhere.
That's
But if you
fine.
want to go down on the floor and fight it, that's fine. But I'm just telling you.
I mean, it's like an ownership
you,
thing.
You
Why
are
don't-
tilting at
Why aren't we
windmills.
allowed to own?
Don Quixote, if you think you're going to
I don't know
get
who
these.
Don Coyote is, but maybe he's before my generation.
You ever heard of
But,
the tilting at windmills?
Jared, is there, I don't know that much about it. Are there disclosures that clearly state this is what you're paying for and this is
Apparently
what
not.
is optional?
Apparently not.
And is there any way to say, well, we'll rebate you for the speakers if you decide never to?
That would be a reasonable amendment if we said, hey, we've installed
But
these.
I would like
speakers.
the disclosures. I think that would be something that would be beneficial if we just had a bill that said, here are the
But I
optional
think, but there
features.
is
Mark
something,
here? Is Mark here?
there is something deeper to this, right? Like there is the idea that, GM now, the incentive structure it creates, right?
Mark Brown?
GM now is going to disable, starting next year, Apple Play and Google, or Apple Car and Google Car, so that you have to use their system and pay a subscription for it versus being able to just plug your phone into it. Like all of these things, and it's going to force us down a model where you never actually own the equipment you bought fully. You could pay this loan off or buy it outright, and then in order to have the functioning equipment in your car, you're going to have to pay indefinitely. And this is not going to
Recurring.
make people happy.
That's what.
I understand the business model. What I'm saying, if it's serious or if it's that requires another company or OnStar, which requires a staff working
But those
somewhere.
speakers are another company. Those speakers are not made by the car company. That's
Yes,
another
but
company.
but the car companies aren't sitting somewhere and sending in a signal so that they can work.
It's
They're
about,
wired
it's
into
on
the
your
radio.
phone. It's on your phone. You turn it on and off with your phone.
No, what I'm saying is there are 8 speakers in there, and if you say only 4 of them get to work, I paid for 8 in the cost of my car. Why should I have to pay monthly?
No, you didn't pay for it because you were probably told at the time.
No,
that
no,
you
no,
wanted that
no.
extra
When they
feature.
install those cars, they paid for that. It's built into the cost of the car.
I understand that rationale. Okay, I understand that the car was already built with the speakers.
Yes.
Okay, so the question then is, do you think the manufacturer's not going to deliver that car to New Hampshire with those 8 speakers? Or is that manufacturer going to say that in the price that you will have this recurring cost? Do you really think that these manufacturers, why the state of New York, the governor vetoed it, was crazy? It's a Democrat woman, right? She, okay?
She's crazy.
Okay.
I don't know much about her politics.
So that clearly that if you I don't I have to
I don't know
to follow up on the speaker one. Which car company was that?
I think it's Audi. Well, is it brand
You have a
new?
new Audi.
I don't know, some of the claims that were made during testimony, for example, lane changer. Every car has lane changer signal sign these days.
And it's just going to keep ramping up because
Which one stops?
it's just going to keep ramping up because there's no way around it. There's no way to escape it.
I'm pretty sure that this business model that they have chosen, they're going to be very careful about doing it after the whole time. So we don't have to do this today.
yeah, can we entertain like
we
a,
will revisit this again on March 3rd.
Okay.
Okay. And I guess what we need is
amendment.
is to get the list of the companies the list of the products that you're saying that you are focused in on, and then we got to have the manufacturers come in here and tell us whether it's true or not.
I think we could
I mean,
probably
it's true
settle
based
on,
on
disclosure, right? That's kind of.
Is
a
all you
basic
wanted
thing.
disclosure?
As a first step.
Well, I mean,
I
think it
well,
helps-
so
it
here's
helps
my
the
problem with
market-
the
it helps the
disclosure, though, is that
market
you're
enable-
paying upfront. Like if I pay for a V6, that has 300 horsepower, and they tone it down to 250 horsepower unless you pay for the premium package, there's a problem with
Okay.
that. If I pay for 8
Let's
speakers,
stick to the one that's really true. That is that electric cars, that if they have a governor on them, which is an added device that you didn't really want, and you certainly never asked for, okay? But they put on there and basically says, what that does, that governor says, you are going too fast, and literally shuts down your electric motor. I mean, I ever rent a U-Haul truck that had these governors built into it, that you drive and all of a sudden you can't get above 55 and you swear at the car. Well, that's what these cars have, these electric cars. Made me think twice about buying an electric car.
Interim study this, Bill?
Are you interested in? the
no,
interruption?
I want to.
He wants to have a floor fight on
Well,
this.
if you want to have a floor fight over it, then
He
just
will.
go down the well and IPL, you can pull it off consent, you can.
No, no,
have
no,
a floor
no.
fight. You wanna have a
No,
floor
we
fight
wouldn't,
here.
I wouldn't make him do that because I'm sure he'll be somebody else here who agrees with him.
Can I say a few things?
Can
I don't know whose turn it is.
This is a conversation.
Okay.
Anybody can.
I mean, here's my reasonable take on this. I mean, what I see is reasonable, and maybe it is, and maybe it isn't. If there's data coming from an outside your car and you're depending on that for those functions to work, then I think you should probably pay a subscription because it requires collecting the data, computing the data, sending it to you, right? But if it's completely just within your car, then you should probably not have things turned off. Or, it becomes like rent seeking.
It's totally rent seeking.
The typical example of rent seeking is there's a river and there's barges flowing up and back there, and someone puts a chain across the river and charges people entry, right? They're not adding any value. They're just extracting fees for blocking access, right? So I think the heated seats is a perfect example. Like, what data do you need from outside your car to have heated seats? So, I mean, I'd want to know that stuff when I want to go buy the car and decide whether or not to buy it.
I mean, they have a lot. Yeah, there's a whole list. She sent out to this whole committee what I'm reading off of, and then I've had a ton of people. This has been very active on my social media. This topic, because people are pissed about it. Particularly at Toyota seems to be the biggest offender, but Honda, Audi, I'm getting it like a lot of brands. But the thing is, I think there's just a fundamental like common sense of fairness, and you can try to intellectualize why, but different things inside, we all can fundamentally say, hey, I paid for this equipment and you just turn it off remotely.
There is
That
another,
feels unfair. And the biggest offender appears to be the remote starts. And they install it in there, the equipment to be able to do it, and then they shut it off after 6 months. That's what Toyota apparently does regularly. And
HBO does it. We're going to give you free or my DirecTV. They're going to
okay, but that's not analogous. Let me stop you right there. That's not analogous because they didn't install a remote HBO thing on your car.
Install the HBO right away.
Like you have a
They
remote.
gave me that HBO app.
You have
and
some
I
sense.
used it, and then
I
when
think
found
you're
out
missing
I
the
can't.
point here, John. There's a starter in your car that starts the car.
I believe you me. I know this issue with Volvo because.
Okay, so you shouldn't be making the
because
HBO
I
argument.
I originally had to pay a third-party company to put in a starter.
I get it.
And then they said, "Oh no, you can use this thing. You on the phone, you can get that app, the Volvo app, that then allows you to do it."
So the remote control starter's there.
In this case, if you didn't want to pay that monthly fee, you can go out and get a third party to install the starter for your car.
But somebody's already got this. They've already
I have
put the
a
remote
question.
starter.
Fuel to drive around with the extra weight of the starter. the whole time.
I have a
Okay.
question.
Not just that. It's
So
just that you
can we-
paid for the installation of that equipment.
How about disclosure? Disclosure.
I definitely would like the disclosure because that is not.
We can talk
that-
about it in like
yeah,
a week.
that's
I don't
not
think it's
fair.
good.
Okay,
I'm not
perfect.
committing to that now.
can I make a
Okay.
comment? Can I make a comment?
Yes.
One of the reasons that the manufacturers are doing this, putting the 8 speakers in a car that isn't going to be turned on for 8 speakers, if they run one assembly line,
It's cheaper.
it's cheaper. And you get the benefit of that. In other words, if the 8 speakers were $150, if they had to run 2 lines, if they run 1 line, it may be only $75. You do save money by having them run only one assembly line. So
I
there is
underst-
something like that to be
I
considered.
understand that, but like, that's not falling to the, but, I mean, car prices are obviously skyrocketing. I'm not gonna blame this for it, but if that were really true, that, which it is true, what you're saying is true, I'm not disputing what you're saying, but logically, if that were true, there would be no need for them to build a high performance, whatever, speaker system and a base model that doesn't have them, which is traditionally what they did. Like, this has always been a saving. So what it's doing under this situation is it's subsidizing people who could likely afford these more expensive things at the cost of people who are struggling to buy cars. So when you have somebody who's the base cost of a car now goes up because this additional equipment is in there they'll never use. And then it's a little bit cheaper for the person who's wealthy. It can buy a car with the 8 speakers and then may or may not choose to use those speakers. But the person who needs that entry-level car, it's not cheaper for them because there's equipment that's included in the price.
Okay, we'll skip this up and we'll take it up on next. Okay, 1207, relative to certain laws applicable to state chartered banks and credit unions, trust companies, and other consumer credit entities subject to the authority of the banking department. This must be my bill, right? And we have an amendment for it?
This was brought by the bank?
Yes. This is just technical, correct. So this, right, so nobody, we don't have, so we only have this?
Yeah, I emailed in our amendment this morning.
Okay, yes, yeah, so we did get it. So I guess it was passed around to you guys and this is an agreement between the bankers and the banking department? No, you're still not happy with this? Uh-oh. Ruh-roh. Okay. So, what, are we gonna get it fixed by next week? Or 2 weeks? Yeah, come on up. Come on down.
Good afternoon, Christy Merrill from the New Hampshire Bankers Association. Thanks for letting me address this. We did see this and we appreciate the department taking into consideration our concerns with this. The bill as proposed had a flat fee of $28,000 for examinations. This amendment has now reduced it to $23,000 for credit unions and trust companies. We appreciate the separation of there's the per diem fee has been addressed for banks only as we asked. We are just looking for a little bit more information from the department to make sure, because there's obviously a difference between 28,000 and 23,000. So we just want to make sure that the assessment doesn't result with banks paying more to make up for that difference in any way.
So, yes, I see 23,000 for credit unions.
And trust companies, yes.
And trust companies was, I see state chartered family trusts are only 11,000.
Those are for family
Yeah,
trust
they're family
companies.
trusts, right.
Yes.
Okay. So I don't see you guys in here, so that's already in the current statute or something? Is that why I don't see it in
No, it's on page 2. I mean, I don't know if Seth wants to speak to
page
it.
2? Okay, I guess I don't see it off the top of my head, but I'll believe you. It's in there somewhere.
Yes, so the way that page 2 is written, it just modifies the current exam fee process for banks. And so this, we appreciate this, we do like this language. Just the concern is that because the 28,000 for credit unions and trust goes to 23,000, we just want to see a little bit more data on what the impacts will be to the assessment for banks.
Okay, and that's the only problem?
Yes,
Okay, thank you very much.
thank you.
Who do I have from the banking department here? Okay, here he is. You're too tall, I couldn't see you. Right? So, was it intentional to they give those nonprofit, they're nonprofits, right? These, these credit unions, they don't pay taxes as it is, and you're getting them a discount on their fees?
No, I don't consider it a discount. What the original bill established it at $28,000, and that was
Yeah.
based on the average exam cost looking back for a period of time.
Okay.
And that's how that amount was derived. Based on further discussion with the stakeholders, including the credit unions, that got reduced to 23, and now we continue the dialogue with the banks. We understand they have some continued concerns with that. And the bank commissioner, she couldn't be here today, but she's committed to continuing that dialogue to get to
Okay.
a resolution that works for everyone.
Right, but we got to get this amendment done for the 3rd. So what's the time frame for you to get this resolved?
Yeah, we're committed to resolving it within by whenever you need it. Yep.
No, I need to have, we can't do this. We have to go to legislative services. Yeah,
Understood.
So we need a couple of days ahead of time.
Okay.
And that means, we need it to legislative services by the end of this.
And by the end of this month, understood.
Okay.
Yep.
All right.
So we're doubling a fee. Page 6A1, I think that would be, we're going to double the fee for a new state bank or credit union charter, 15,000 to 30,000.
I can speak to that. This is not actually doubling the fee. So under current law, the way it worked was there was the $15,000 flat fee, and then the bank commissioner, we track our time in connection with those applications. And under current law, the excess based on our work that goes above $15,000, we bill to the applicant. So what we had observed was those fees turned out to be approximately $30,000.
flat fee.
So we're just turning that into a predictable flat fee, and it eliminates, and that's what the next page is.
Does that
It
apply to big
eliminates that.
banks? Big banks and small banks are the same, or?
It apply any bank, trust company, or credit union that would apply. It's
My
the same
question
fee.
is, you had a flat fee of 15, then you charge for anything over that. The overcharge, is that the same for a small bank as a big bank?
Well, we've observed it's been about the same regardless of the application type. It's been right in that ballpark, yes.
Thank you.
Okay.
Thank you.
Thank you. All right, so we'll skip that. Okay, home heating oil and propane contracts. So I got
I think last time you had spoken to P again
Yeah.
and wanted to work
So-
with Attorney General
So
Office,
what I
right?
got, here's what I got. Sorry I didn't make copies of it, but what they're suggesting is putting into the current statute that the Propane Gas Association for New England Consumer Assistance Concerns have their email address and their phone number, disclosure of all fees so in other words, that they're giving, if you have a problem, it'll be right in the statute that to contact the Propane Gas Association if you have a problem with your particular gas company. Disclosure of all fees they may be charged in addition to the price per gallon for delivery or fuel. So that must be these are in the contract itself. So
Yeah.
the contract has got to have the disclose of all the potential fees, and it's got to have the Propane Association's 800 number. And then there is the tank rental fee. And this is the one actually I'm a little hung up on. So the issue was, so now you've decided that you're really not happy with somebody and you want to cut them off and get it from somebody else. Well, now if you do that in the middle of the wintertime, now you have a problem that you've got this tank in the ground and they can't get it out of the ground. So so that if a consumer provides written notice of discontinuance of the contract, shall make every reasonable attempt to transfer ownership to the consumer. In other words, they should somehow, basically, if the consumer wants to change, they, convince the consumer to pay for it, or get another dealer shall otherwise they have 60 days from the date of that written notification to remove their tank, or as soon as another weather and access to the tank allowed. And if the tank installed underground is providing to a consumer, a contract for such tank shall contain a clause providing that the consumer with the option to purchase the tank and associated equipment at any time during the length of the contract. So I assume that a lot of people just think it's what a great deal to hook up with a propane company and they're going to give you a free tank and bury it. And that's all seems great until the person doesn't deliver, and now you have this tank problem. I personally think that they should stop doing that giveaway, but I guess that consumers would like to have that.
I think this was more a problem of implementing, and there was a communication gap between, the company, PGAN, and the Attorney General office. That's why they're receiving so many complaints.
You would call it complaint, right?
Yeah, but I don't think using a legislation you can solve that. It was more of if they coordinate. That's why you took their number. You said try to provide the number to the consumers.
So I
If
have-
something like that, right?
I have real life experience with this. So
Okay.
I have propane, and it was very difficult for me to get a status on my scheduled delivery. So I was in an absolute panic for about a week because I had no idea if my home was going to be destroyed or not because I couldn't get a status on my delivery. It is definitely a real problem. And I want to thank the Assistant Attorney General Stewart for talking to me about this, and the P. Gagny people for also talking to me about this. But I knew because this bill just arrived here. So
Right.
those resources were invaluable. But this issue, it affects a very small population, but it's a significant problem. So I definitely think we need to do something. And Assistant Attorney General Stewart shared what Vermont has done. So there might be some additional verbiage that we would want to put in an amendment to this bill. For example, I'm sorry, I don't have it in front of me, but for example, if you have your tanks removed and there's fuel left in the tank, some companies don't refund you that fuel. So there's some progress that we could make to try to make this process a little easier. I had no idea that this was such an issue for consumers, and it's growing because of the consolidation of the industry. So having consumers not know if they're going to get a delivery or not, and not having an alternate heat source and no option in the middle of a winter is definitely a problem, and I have experienced it, so.
And that is where the PGAN staff, they had stood up saying that they are the association who handles such complaints and they will take care of it. That's what they
Well,
said. But they did
could
not.
try, they
I know.
could try, and they have influence, and the Attorney General's office has influence, but I think that we need to do something legislatively to make sure that there's a better awareness of this issue. The Attorney General, the way I understand it, is all on board with trying to provide better solutions because these problems are just escalating year over year.
That's true. They do support.
Did you give us the Vermont law? Did we ever get the Vermont law? Okay, yeah. Right now, I get 1,000 emails a day, and it's been an absolute nightmare for me.
But I also remember they had mentioned that propane is not covered by utilities regulation. That is what they had said.
Again?
Propane is not covered by utilities regulation, something like that. That's what they have mentioned.
Okay.
The Attorney General office do take the complaints. They get around 50 complaints per year, and they try to help and resolve. But they mentioned that it's not in their purview because the propane is not covered by. I wrote this note that said propane is not covered by utilities regulation.
Right.
I don't know what it means, but
But I think, the disclosures are good, having the information is good in the bill. But
yeah,
there's-
I'm all for solution. It's just that whether this bill can help solve the problem? That was the
Well, it
question.
could just provide better information to consumers.
Representative McAleer.
I've got a question. Do I understand that if you trade your propane company, that you have to use their tank, which seems to me to be ridiculous? In other words, if it's in the middle of winter, you're not going to be able to trade tanks quickly. There should be a waiting period. In other words, I should be able to change from Eastern propane to White Mountain Oil propane and have them at least have like a 90, 120 day term that they can fill the tank before they replace the tank. I mean, it's just foolishly you're locked yourself in if you can't, if you have to use the other company's tank and they can't get to it because it's underground.
Right, and there's an so in order to switch companies, the new company wants to inspect the tank, or they want their own tank. So if you own your tank, they want to inspect it.
It's fine.
If you rent your tank, they won't fill, and please correct me if I'm wrong, they won't fill somebody else's tank. There's a problem.
That's wrong. That's
No, it's and in the wintertime, it's a very
Right,
big
but
problem.
but my personal opinion is that we should stop having these free tanks. And that if people are complaining about it, if this is a problem, then we should require that the homeowner must own their own tank.
In the meantime, isn't it reasonable if I change oil companies that the new company be able to fill or be directed to fill that tank until they can
you
change
can't.
it?
That's liability issues. Here's the problem, okay? And that is the tank issue of wanting to replace the tank, or replacing your oil company doesn't happen in the summer.
Right.
It only happens in the dead of winter
In the worst possible time.
when you have 3 feet of snow out there. Okay, so we're really chasing our tails to try to solve a problem, because theoretically the happy homeowner is coming to and say, oh my God, I just they didn't deliver. They always delivered in the past, but now they don't deliver, and now I want to change companies, and I'm stuck because I have this tank that I got for free buried in my backyard, my yard. And you're saying is, oh, well, George, just say, don't worry about it. No, what you would say to him is, oh, well, call the 800 number and call the Attorney General's office, and they'll try to chase that guy, whoever who's supposed to be delivered, and you got to get through the season.
Yeah, exactly.
You got to get through the season with the one you don't like. That's the
I
problem.
mean, this isn't going to solve it, but I think the disclosures and the numbers could be a good first step.
Those tanks are quite expensive. I think a lot of people can't simply afford them. And,
Well, it's,
you're paying for it anyway because they're charging you more for the gas, whatever.
Representative Braderman. Sorry.
Yeah, I think in Vermont, the way it works is you have an underground tank
Yeah.
and you switch companies. The companies have a deal whereby they transfer the ownership.
Right.
You stay out of that entirely, and it's seamless. And I know this because my son just went through it in.
So does Vermont do that by statutory, or why don't you come on up here with a microphone? So.
I apologize, I just got
Turn the mic on.
You have to push the button.
Turn the mic on.
Yeah, there you go.
There, okay, I don't have my Vermont statutes with me.
Okay.
But I know, my recollection is in Vermont, if the tank has been on your property for 12 months, then you own it, because essentially they've got their money back during that time period. A lot of these tanks have been sitting on the property for a long time. It's not like people start with a company and then they change 6 months later. That's not, I don't.
That doesn't happen. No.
That doesn't generally happen. So I think this concern about the companies getting their money back for their tank probably isn't, after 12 months, they've probably got, or even 2 years, you could say 24 months. After 24 months, the consumer owns the tank, something along those lines. And then another thing, our office was just talking with PGAIN about this, some representatives from PGAIN about this emergency in the winter. This is the problem. And
if we could possibly work up some sort of, or they could work on something that if you can't deliver, if a company can't deliver in some defined emergency, whatever that is defined as, they can release to fill the tank to another company for that time period, just so that people are no longer in a panic. Because that's what happens, because you can't reach out to anybody else, so that there's some sort of backup plan. We literally just started talking about that. I'm sure we could work up some sort of language if we needed to, or you requested it, to do that pretty quickly. But I think the tank ownership issue after a period of time, and that's what the Vermont statute does, I think that's a reasonable, I mean, to require consumers to purchase all tanks, that may be an impediment to people because they can't afford it up front. But certainly after 12 months or a year, the company has gotten their money back with the delivery of the propane.
It just need to be in this disclosure to saying, by the way, because we're bearing this tank, you can't replace it for a year.
Well, if you move after 12 months, you'll own the tank.
Right.
But if you move before then you got to pay us
Then
or
you're
something along those lines.
Right, something like that. Okay. So Scully, were you talking to Scully?
Oh, yeah, and Leslie
Okay.
and all the people back there. Yeah.
Okay, so, given we have a timeline problem, you're gonna be around next week?
What is the
Okay.
timeline?
Scully, you gonna be around next week? Oh, well. I assume there'll be someone else in the office?
Yeah.
Okay. Okay, so, I need something by, it's Friday, yeah, the end of the month,
The end of the month
the end of the month.
to address which issue? The tank ownership
The
issue?
tank, oh, yeah, the tank ownership issue.
Okay.
And then we're gonna put in the 800 number. So have you given her what you sent me?
We
She's
did,
got this.
yeah, I just got it.
Yeah.
And the Attorney General's office, I mean, we're not particularly comfortable with all calls going to P-Game because we're responsible
You
to,
would like the calls to come to you.
we'd like to know what the problems are. And if they're
Right.
going somewhere else, we don't know what the problems are. So the
Okay.
goal is to solve the problems, not to like hide them from us. Like that's what we want to do.
Well, here's my point, is that if we have a statute and you are actively involved in enforcing the statute. So what I'm asking you to do is give us something that we can pass that you can enforce. So at this point, we're going to give you carte blanche. And what you write in that amendment, I do advise you getting the propane people to
Okay.
And that, but yes, do you have a special number for propane problems? Because I know when I call the consumer protection line,
No, it's a hotline, the regular hotline. We don't have a special number.
okay. So, you got to get an agreement from them to every time that every time they get a call that they pass on that information to you. You need
Well,
to-
this has to do with the contract. So the information,
This is just a contract, right?
yeah, so the information that's in the contract should be to call the consumer.
But this other
consumer
issue
pro-
about when, if there's an actual emergency and you can get, and who's gonna negotiate getting somebody else to deliver the other propane? Wouldn't they be the ones to be doing that rather than you?
Oh, absolutely. So what I was suggesting is maybe there could be something, I mean, I don't even know how to phrase the language, but something along the lines of if you're not able to, deliver within a certain period of time during certain month period, just like the PUC,
Right.
then you have to provide an alternative. I don't know.
Putting the
We'd have to
onus
work
on
it
the-
out.
On the company that if you have a moment where all of a sudden you know full well that some customer you're not gonna be able to deliver, that you need to, that your system says it's time to that delivery, that at that moment,
Somehow,
they're
yeah.
gonna call the propane the guys, the PPNs, and PPN's gonna give you notice that this is occurring. but the PPM is gonna find the other company to do the delivery. Did I make that sequence work right?
I think that's more complicated than it would have to be. It
Okay.
would just be that if a company is not able to deliver within, I mean, I'm making this up, when the consumer is at 10%. I don't know if
Whatever
that's
the due
reason.
date,
I don't know
whatever-
if that's
right,
reasonable or
whatever you
not.
come up with.
Whatever that is, if they are not able, then they are automatically, or they will be notified that they may seek alternative source to fill their tank for that period of time. And then if they want to get out of the contract at a different period of time, then they can do that. So because there's two problems. There's the emergency problem, and then there's the long-term
Long-term
contract problem.
solution.
Yeah.
Right.
So the emergency problem, if the companies, because right now the companies are not releasing, they're not allowing other companies to fill, and other companies won't fill a tank because they have to do safety checks. But if the, company A can release that safety information to company B, then company B can say, okay, then we can go forward with that information, fill the tank this week, and then we'll deal with the bigger problem later. And that just kind of relieves the pressure on it. I mean, that may be an option.
Okay.
I'm sure Leslie's like, what is she talking about?
Okay.
That's what I think.
You guys will work
We
it
could
out.
try,
And
yeah.
Have something for me by the end of the month.
Absolutely.
Okay, great.
Okay.
Okay, all right. Okay. How are we doing this? How are we doing here? Okay. Okay. Okay, next. Establishing an interagency task force to determine New Hampshire may implement an R-Pacer program. Was this a study committee did you have? Was it a, what? Yeah, oh yeah.
No, it's not a study committee. It's just it's a task force of agencies that that would look at this, and I'll have to look and see exactly what the
Yeah.
agencies are. The
Yeah, I see the BFA, the Housing Authority.
Yeah, the BFA currently is the administrator of the commercial equivalent of the R-Pacer program. The R-Pacer is residential PACER program. C-PACER is commercial PACER program. And that commercial program was, the responsibility for that was shifted over to the BFA last year in one of the first pieces of legislation that Governor Ayotte signed. And when I approached them about establishing the R-Pacer program, they were reluctant to take that on because of the fact that when you're dealing with residential properties, there's more disclosure requirements. So they pushed me to the Housing Finance Authority, and the Housing Financing Authority said, whoa, no, we don't, we're not sure we know about that, and we're not sure we're ready to take that on. So what I was able to do was get the two of them to agree that, yeah, maybe we should look at this. And then there were some other entities that would be involved as well, who might have a stake in this. The Department of Business and Economic Affairs and the Community Development Finance Authority. And really what the bill is trying to do is just say that to those groups, hey, we want you to get together. We want you to produce, to take a look at this and come back to us and tell us whether, what are the issues associated with this and whether it makes sense or not. And if it does make sense, who would be the appropriate authority to administer it?
So somehow,
It's not a study committee.
somehow, well, it has no legislators.
There's
on
no
it.
legislators.
And
Right.
you're just gonna hope that these people show up and come back with somewhat.
And part of the reason for doing that is just the timing, is that, we're in the second year, and I wanted to give the group enough time to look at it, so I said, gave them until next summer to look at it.
Yeah.
The, is this gonna have anything?
what you're talking about, does this change in any way the housing finance, the government activity, that are deal with housing that's in place already?
No, no, this would be something, this is the look at whether we want to extend something new.
So
But at the end of the
it's
day,
totally
this is
different.
going to cost the state money to implement.
It would cost the state money if the agency that ends up being designated as the administrator feels they need more bodies to do it. But again, it's a program that we're already doing on the commercial side.
Right, that's what I heard. That's successful is the commercial side, but the residential, this was, we were going to be chasing our tail on this one. This is never going to happen.
So it's always wonderful coming to this committee.
Yeah, he's a former member of Commerce. He's a former member of the committee. How many terms were you on this committee?
I was on this committee for 2 years.
2 years.
2 years.
2 years.
2
Yeah,
years.
2
One
years.
term.
One term. One
Was
term.
enough.
One term was
Yes.
enough.
Yeah. Then I was like,
I mean,
it's the reason I proposed this was that this program would allow homeowners who want to do something to make their properties more resilient tap into some alternative financing mechanisms to do that. I spoke about, the flooding issues that we have, and it's not just on the seacoast. We have challenges in the mountains, the western part of the state. We tend to focus a lot on making resources available to municipalities to address to enable them to respond to the challenges that flooding creates. We're doing something with the CPACE program for businesses, but we do very little to help individual homeowners that want to try to do something themselves. And this is one way to try to do that.
okay. Jen? Doesn't this sound sort of like something that the insurance department is working on also? So you might come up here and take a microphone. I don't know if you know about this.
Did know that I had spoken with the insurance commissioner about a program that is going on. I don't think it's the same as this program, though.
No, it's a little bit different than what Representative Munz is proposing, but we we introduced it to the committee last year, tried to put it as an amendment to an existing bill, but we've taken the summer and gone back and modified it. But it now currently resides in SB 562, I believe it is, and that's just past Senate Commerce, where we are creating a home resiliency and mitigation program that's going to hopefully provide some assistance to homeowners to mitigate some of these risks that the representative is talking about. The biggest change when it's coming your way is that the funding will not be coming from any state funds. So we've tried to look for alternative funding sources to try to help bring into the program. It will still hopefully, as drafted, allow for federal funds to come in if those become available. And this is a big initiative of the NAIC. So regionally, there are a lot of states that are trying to pool together to also see if there are a way to get additional funds into the states to help mitigate some of this risk for homeowners. So that would include foundation work for any type of flooding issues, limb and tree removal, roof doing work on your roof to mitigate some of these extreme weather risks. So that is currently, it's passed the Senate now, so.
Okay, but money, you still haven't got the money yet.
No, it's going to be, the way that it
Where-
is set up, it's going to be from kind of private or philanthropic funds.
Right, contribution.
So-
So, you see what I'm saying, that getting money for residential
Well,
can be a hard sell.
the difference with this is this is not, there's no state money that needs to be invested in this program. I mean, it's not like we're not.
No, you're
we're not.
only gonna
We're
use
not.
this-
We're not. We're not
BFA
appropriating.
funds, right? You're looking to open.
No, we're not. We're not appropriating any funds towards to be used by. We're not appropriating any state funds that homeowners could tap into. What this is, it takes advantage of a program that's out there that so that they can go to private lenders and get the money The biggest thing that it does is it attaches the I want to make sure I got this right because I've been dealing with I'm not going to say what I was going to say because I'm not sure it's true. But
But there's going to be a second mortgage.
yeah, but it doesn't require any state funding.
Okay.
It's done on the private. It's a private
But it
program.
doesn't have any ways to get, if you're hoping they're going to get a lower interest rate with these second mortgages because the BFA is involved?
There are specific lenders that are qualified to offer loans for these types of programs.
Okay.
I just,
Representative Herbert.
my question dealt with the commercial side of it. So there are people that know all the ways of coming in and addressing the quality and expense of whatever they're looking at. And the tenant owners, these are people that put up a lot of, apartment buildings. And then I just wondered if that was going to be influenced or diddled with at all, because it works quite well in the commercial sector. And I just wanted to see if somebody was going to mess it.
My understanding is that the RPACER program operates exactly the same way as the commercial program does. The challenge and the CPACER program I think has been implemented in I want to say like 40 states, so it's broadly accepted. The RPACER program has been less widely accepted. I think there's maybe 2 or 3 states that have adopted it.
Which states do we know?
It was in my testimony.
Okay, so here's what I'm saying. The best we can do for you, we can interim study it and we can go track down these states and see how they're doing, how it's working. California.
Why wouldn't we just ask these agencies to take a look at this issue and get back to us?
I'm worried that they're going to spin their wheels and come back. I don't know. How do other people feel? Anybody want to send these people off on this wild goose chase?
I don't.
Anybody else have an opinion, one way or the other? Well, that's right. I do have California and Florida. That's right in front of me. Yeah, well, those are 2 states. Yeah. Oh my God. Yeah, they're the 2 states who have the biggest problems. But,
Yeah, and as you've heard me say, I mean, there are people on the seacoast, that are getting inundated every time there's a high tide, and we need to do something. And I guess what I was hoping to do was evaluate whether this makes sense to add to our bag of tricks.
Okay, we'll skip this for the moment and we'll have the week to sleep on it.
Anything else I can provide to you to maybe sway you
Something
one way
else
or the
you would
other?
like?
So I think in California, they had a problem with seniors being targeted by contractors. Like, could you talk about that?
That is the challenge. I mean, there are more disclosure requirements that what they've learned from experience in some of these other states is that there has to be much more done in the way of disclosure to residents so they actually know what they're getting into. There needs to be some consumer protections to protect them from contractors that are trying to take advantage of them, and that's one of the issues that the BFA had when I approached them about doing it. I mean, the actual administration of the program, the CPACE program, is relatively straightforward for them. It's just those other additional notifications, and that's when they pointed me to housing, because they said, well, they deal with home buyers all the time. We don't. And then the Housing Finance Authority said, yeah, but it's a program we don't really understand. So.
And worse of it is that you say the contractors, but they probably go look for houses that have no mortgage on it, and then knock on those people's doors and tell them a pitch that, you know, that they're gonna, elderly people, you know, or elderly, yeah.
No, they're very legitimate concerns, and the idea was, and that's why, I backed off pretty quickly after talking to them about, insisting that we try to, that we put a bill together to impose it.
Come to the table to figure out how to do it?
Yeah, then I've talked with them, and,
So if every one of these people said no, 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 then why would we drag them together and talk about it?
they said they weren't ready to say yes or no.
Okay.
They needed to understand better, and I did
Okay.
talk to them, and I did actually.
All the more reason why I would say we should interim study it.
I
so we
did
can-
manage to twist the arm of the executive director of the BFA, and he agreed that he would serve as the chair of the task force. So
Yeah, he's being nice to you.
it's a
Okay.
chance. It's a chance for New
All right,
Hampshire to be in the
we'll
lead
s-
on something.
We'll sleep on it.
Okay.
All right.
Thank you very much, Mr. Chairman. Always a pleasure.
Always a pleasure, Chris. Okay. We'll have AI. We'll have AI figure this one out for it. Okay. Prohibiting the discrimination against cash buyers in business transactions. Yeah, I'll move ITL.
I don't think it's easy to implement this.
No, we don't get it too often. We didn't- Really? We've had to try to, yeah, okay. Okay, so, this is the business, I mean, we're kind of getting light here. Is there anybody opposed to the ITL idea of? Okay. Yeah, 1339. This is for our freshmen, freshmen for the day. The bill requires that businesses have to take cash. If for whatever reason their business model is they don't want to take cash, that this bill would say they have to take cash. Well, that was the contention of the testimony, but it was this is legal tender, or right, exactly. But there are some businesses who don't want to take cash, and the ones I think of most are like it was started out with the airlines, and and some of the, let's say, businesses that are working established and selling beer and wine or something, and they don't want to have to come back. They give you change. They just want you to give them a credit card. Do you have It's right. You don't have to vote on it because neither will be back. Right? But I just want you to, it's to just let you know what because I was telling you you're reading it, and I said eventually you'll never know what this bill is. Right? So okay, so at this point we're going to go forward with ITL. All right, relative to discount motor vehicle insurance premiums for volunteer safety inspections. Insurance. 1398.39. We want to ITL it. Okay, all those in favor of vote, are you killing it? Raise your hand. Okay, those opposed? That's the business. Well, I was saying we're getting a little light here, so I was just, that's why I said, is there anybody in the room who doesn't have
Oh, I thought it's subcommittee.
has a strong opinion not to kill it? That was the thing. It doesn't matter. There's no number. It says, okay. All right. Motor vehicle insurance premiums for volunteer safety inspections. Oh, this was really insane, wasn't it? This is the one. This is,
ITL.
yeah, ITL. Thank you. Who wants to make the motion? All right, perfect.
But you're going to answer the question.
Okay. All right, prohibiting insurance companies from considering the driving record. This is Representative Reed's amendment. That it turns out that State Farm, they refuse to write. They're not interested in these. So that to them, this legislation is a mandate onto them.
Can I make a comment?
The insurance department bent over backwards to try to help Representative Reed to have something, but so before charging an increased premium due to an insured operator household member whose driver's license is suspended or revoked, insurance shall inform in writing the primary policy holder of the fact that the premium is increasing due to the revocation or suspension that it named excluded driver endorsement options. So,
Should that say increasing or not?
or non-renewal.
Insurance companies should have a choice.
Right.
You know that 19-year-old kid's gonna get dad's car, go driving.
Well, that's the reason why they're not writing it.
I think,
And
yeah.
and we had from the representative of the insurance writers, or what do they call them, makers, sure, you know, that they were opposed to this bill.
Yeah.
So. Yeah.
I really think this should be ITL. I had this experience as an insurance consumer.
Yep.
And when my policy renewed or whatever it was, they picked up one of my sisters and one of my father's ex-wives and said they live at your house and we're gonna rate it based on that. And I said, no, they don't. And I had to establish that they didn't, but the insurance company was quite clear about it. It wasn't hard to get them to say, oh, they don't live there. But if they did live there, back to what Chris said, you know, the 19-year-old kid's gonna borrow the keys to dad's
Well,
car at some
exactly,
point.
right, there's no way you're gonna keep them
Yeah.
away from that car, so. Okay,
Let's say your elderly parent has a bad driving record and then you take the keys from them and then they move in with you. I don't know if that
then,
that could be a
you're
realistic
screwed, then
scenario.
you get screwed, yeah.
Yeah.
Okay. So,
Take the keys away.
okay.
Well,
So,
get
would
rid
you
of the
like,
license.
would you like to write
Take their license.
make the motion when we take it up on,
Sure.
okay. Okay, Thaxton will do ITL. You don't need a vote. Unless somebody really is adamantly opposed to the ITL. Speak now or forevermore hold your peace. Okay, relative to risk pool programs, this would be me, and it would be OTP. And I would have to say that I had a wonderful conversation. We already did it, but I'll just give you a new update. I had a wonderful conversation last night with Senator Gray at 10 o'clock at night. And when the call ended, I was kind of feeling like this is going to be deja vu all over again. But then he called me at 9 o'clock this morning and suddenly he said, well, maybe he had a change of heart. So there is hope that we can actually get this issue. So the Senate is going to send us a bill, that is for sure. They will send us a bill and who knows what'll be in it. But that in terms of what we will negotiate and going forward, Rhea, there was some, he's saying, well, why can't we just put this other alternative into 5G? Because RSA 5, which is the Secretary of State. And I said, no. If we're going to do it, it has to be in 420. It can't be in 5G. And so it's been an interesting process of bringing him along in terms of educating him about insurance. That's it. So there's hope. But at any rate, we're still going to stick with our position, is that the accessible insurance and risk pools should be under the regulation of the insurance department. Okay, governing special bank and credit union deposits. Okay, so anybody here from the bank still here? Oh, this one. Yes, I keep doing that. I keep thinking about it. Okay, this is a wonderful bill. It's a UCC subject matter. Yeah, sorry. I know you've spent the whole day here and watching this big entertainment, but yes, this is something we want to pass. So OTP. This is 1502. And I always keep getting it wrong in terms of what this is, but this is UCC, so. Okay, 1504, prohibiting retailers from engaging in price gouging on certain necessary products and services. This is a bill we get often. But it's just, it's so, okay, who's gonna make the motion? Okay. Okay. 1582, prohibiting the use of credit information in underwriting and rating personal automobiles insurance policies and prohibiting certain surveillance practices by insurers. Okay, ITL. And I'll write that one. Okay, relative to parental consent and age verification for digital application platforms. Okay, who's gonna write it?
Actually, Representative Dry is showing up right now and wanted to say something.
Oh, okay.
Is it 1582?
Yeah, I'm running ahead here, trying to wind this down. Okay, so we're now at 1658. So you want to make a pitch or something, or you have some new information that you think we need to consider, but there's really lack of interest in the committee to passing this bill.
Very much. I'm out of breath because I'm the clerk and we're in mid-voting mode. So thank you
Okay.
for your allowing me here. I just want to make a pitch that this is a simple bill. It's something that parents want. They want to be able to have the control over what their children are doing. Asking parents to give permission for something is not a bad thing to do. I know that the last time there was a discussion about the Attorney General's office not wanting to want rules about this, and we got that. The woman that came to testify here worked with the AG's person out in the hall while we were still talking and came up with an easy way to fix that problem that the Attorney General's office worked with her on. I have that here possible for you. I'm thinking that we addressed the major problem. That would, to me, seem to be the major problem with this bill. And I'm thinking that if we're going to support parents' rights, we should support parents' rights also to have control over what their children are entering into a contract with. And that's the important part.
Right, so the problem this committee has is that supporting parents' rights is supporting the parents' right to decide to actually give a phone to their child or not, okay? And so, because there's some of us, we would, well, my generation was a little later because I all had the Game Boys, okay? But yes, there was a limit to when we were going to let them have these devices, okay? And so the problem is that the vast majority of this committee is that knowing full well that we as a parent who make that decision to give that child a phone or an iPad or computer, whatever device they're giving to them, we know we also have that responsibility that if we don't want them to use the device for whatever reasons, then we need to know how to turn off those capabilities. So in other words, it's not that the parent needs to get permission every time they go online. The parent has already predetermined with that machine. And if they're feeling that the parent is not qualified to do that, then that goes back to whether the parent was even qualified for giving the device to the kid in the first place.
With all due respect, last year in a different kind of bill with filters on devices, a mother held up the phone and just said, this is the same thing as dropping off my child at the end of the red light district, because it's not one off on a phone. There's so much there. She showed us.
Right, but
what
that's
it
on
is.
Safari, that's Google. That's not even what your bill addressed. Your bill only addressed the buying of apps. But if you want to go see pornography, you don't need an app to see pornography. You just go to Google and
Again, with all due respect, this is not going to solve the problem 100%. There are lots of pieces to the
well, let
puzzle.
me tell you this, it seems to me it's not even solving the problem. I mean, apps is not the problem. I mean, because apps can be turned off. You can literally, any parent can make sure that phone cannot do any app purchases without the parent putting in the passcode. Yes, Representative.
So I had a unique experience this summer. I forget if I mentioned it. Went out to Apple headquarters and we went to, it's called the Mothership. It's a giant spaceship. It's amazing.
Yes.
And they had us in their corporate boardroom for over an hour, and all they talked about was the parental controls and the tools that they're rolling out. And they went over it in very fine detail. I can't remember all of it, but the Apple's very concerned about this, and I believe Google is too. And they're rolling out. They're trying to make it easy for parents to set the age of the child. When the child turns, I think it was 13, some more features get enabled. There's even in the permissions, as the child gets older, they get more and more permissions, and the parent gets to set those permissions. So, I mean, this is an issue. Yeah,
Exactly. And
yeah.
last year, we put in a bill for that exact thing, is expanding the filter. What I'm thinking is that there is a correlation between states saying, we're going to make you do this, and companies saying, oh my gosh, I think we'll do this.
Well, California would be one, right? Like, Little New Hampshire we don't push the market too much, you know?
We don't, but we're always first in the nation. So,
I'm glad to hear you say that. Exactly. We might be the last
Yeah.
state in New
There-
England for some things.
and if you don't mind, there is a lawsuit we'd like to see the end of. The Texas one, I think, will be overturned, the injunction.
So-
So there's things coming.
Yeah, and we usually generally wait until after those lawsuits are settled before we pass things. Yeah, because we don't want to get involved in that. So,
I went over, excuse me, just for grins, when the bill first came up, I went on Verizon and wanted to add a line to my line, like as if I was a kid, right? As if I was asking for a kid. They never asked my name. They just wanted to give me a number, and they said, who do we charge it to? But they did say, if you want to control the screen for the kid, for whoever is on this line, for some number of dollars per month, you get Apple Screen. That's the name of the thing. They already have it out there. If you want to do anything, just put this on the line and you're ready to go. So it seems to me they've already got, and then what they'll do is they'll say your kid can be on the line for an hour, and after that, it shuts
Yep.
the screen
Oh, yeah.
off. And that's all, that's what it does. They've already put out what they can do, but they never asked me if I was under 13. They never asked me my age. They never even asked me my name. They just wanted to know the billing number. That's all they wanted to know.
but you got to have a credit card to pay for it.
But they didn't say who the phone was for.
Right, right.
So, I mean, if I said it was for me, I would be stuck with this. So I don't think there's mechanisms there to be able to do anything other than buy their service.
I just would like to bring it back to the thing that we began with, which is minors can't sign contracts. These are contracts. So,
Fair enough.
okay.
Thank you.
Very much.
Let you get back to your clerking. Okay. So, who would like to make the motion?
Jesus Christ, I get lost in my own phone.
I'll write it. Chris will put his name on it.
Oh, come on now. Come on, you chickens.
What's the motion?
ITL.
I'll do it.
Okay. All right, two left. Relative to oversight and reporting requirements for health insurance carriers regarding the mental health coverages. Is this one we did yesterday, or?
No, that was.
Did we do this one already? Yes, we did. Okay, great. So what is the motion on this one? I know, it should be on one of my cheat sheets here.
This is the same.
I think it was ITL, John. That's my note up
Relative to
top.
oversight
Okay.
and reporting requirements for health insurance. It's a health insurance one.
Yeah, okay. I have a question mark. Wait, no, I had the wrong, that's a different one, different bill. Oh, okay. Yeah, no, we don't want this bill. So okay, ITL, who's gonna make the motion?
I will.
Thank you. ITLs. Okay, and last but not least, enabling wine and beverage manufacturing. I didn't realize this is the last one. And I made the liquor guy stay here. All right, sell products of certain New Hampshire wine and beverage manufacturers. Okay, so this is OTP and this is me.
You want to take that or you want me to take it?
Oh, okay, sure, you can
I'll
take
take
it.
it.
No, yeah, that's fine. For 2 seconds.
You've got enough of them.
Okay. All right. OTP.
John, there's one in the back too.
Oh, one in the back.
Oh.
Oh. Relative age appropriate design code. 50. Did we do this one already? Design code? Age appropriate design code? What the hell?
Exactly.
Idea.
Okay.
Terminology, no push verifications. 1650.
Okay, everybody wants to kill it. That's fine. All right, ITL. Okay.
1650. I have 5 no's.
Okay. All right, who's going to make the motion? All right, all right. Okay, McAleer is done. Write your blurb now, and we will be voting on this on the March 3rd.
So we have this.
Get it done before
Okay.
vacation's over.
We're out of work session, and thank you all for sticking around and getting through this. I really appreciate it.
So we have these for next time?
The things we
These
skipped.
three?
Yeah,
Yeah.
yeah,
And this one.
yeah. So we definitely,